Good morning, and welcome to day 2 of Accelerating Healthcare Innovation in North Carolina. I'm Andrew Kant, Director of Fast Tracks at UNC Chapel Hill. On behalf of us at Fast Tracks and our event co-host, the North Carolina Biotechnology Center, I want to thank you all for joining us today. We hope you enjoyed day 1 and learned some valuable takeaways, regardless of what stage you're at. And I wanted to kick things off with just a note of encouragement. Our hope for putting this event together is to play a small role in creating a spark and inviting you to ask the simple question, what if? It can be daunting at the beginning. There's an avalanche of unanswered questions, uncertainty, and skepticism. And not every idea will see the light of day, and that's okay. But consider it a small beginning and keep going, learning, and trying. Before I introduce our next speaker, I'd like to acknowledge the amazing efforts of our planning committee, Greta Brunei, Corey Curtis, Susan Jones, and Katie Doherty from NC Biotech, and of course my colleagues Sean Gomez and Devin Hubbard at Fast Tracks. Coordinating this event has been no small feat, and I want to sincerely thank them for their efforts. Now I'd like to introduce Carol Lewis. She's Vice President at UNC Health Enterprises and will provide opening remarks and introduce today's keynote. Carol has been a great partner for us at Fast Tracks and the UNC innovation ecosystem broadly. She leads UNC Center for Health Innovation, which is a joint effort between School of Medicine, UNC, and UNC Health. She and her team help clinicians cultivate new ideas to improve patient care and ultimately translate those into practice. Prior to joining UNC, Carol was director of Blue Cross Blue Shield of North Carolina. There, she developed corporate strategic plans, managed pharmacy benefits, and built healthcare provider networks. She also worked as a consultant for Boston Consulting Group, creating strategies for Fortune 500 clients around growth, profitability improvement, new product development, and business portfolio management. Carol, thanks for joining us today.
Thanks, Andy. I'm really glad to be here with you this morning. I'm always so happy to see programs like this where we're trying to help more folks innovate healthcare, especially here in North Carolina. Every day I'm seeing new technology make its way into our healthcare system, and it really is changing our patients' experience for the better. And we just have so much opportunity as an industry for innovation. So always glad to see programs like this, and I hope that all of you are getting a lot out of the content and the material that has been put together. I also wanted to take a minute to recognize and thank Olive, who is our keynote sponsor for today. Olive is the only artificial intelligence as a service built specifically for healthcare. They're working with leading health systems in the country to uncover and solve the most persistent problems facing healthcare today. And we're delighted to have Olive playing a role in improving healthcare here in North Carolina. Remember that you can visit the sponsor and exhibitor pages on the website ncinnovates.org. So we have a great program today. I hope that you're going to enjoy it. I'm going to start us off by introducing our keynote speaker. His name is Dr. Hassan Teta. Dr. Teta is currently the Health Mission Chief for the U.S. Department of Defense Joint Artificial Intelligence Center. He's a U.S. Navy captain and an associate professor of surgery at the Uniformed Services University of the Health Sciences, an adjunct faculty member at Howard University College of Medicine. He's a thoracic surgeon, and his research in thoracic transplantation aims to expand heart and lung recovery and save lives. Dr. Teta is also a best-selling author of several books, including the Art of Human Care book series. He's been named a TEDMed Frontline Scholar, and he is also a TEDx speaker. So please join me in welcoming Dr. Teta this morning.
Thank you.
It's nice to have you here. Before I turn this over to you for your prepared remarks, I did want to ask you about one thing that I noticed in reviewing your bio for today. I noticed that you have 4 different graduate school degrees, and it's unusual to run across somebody with so many graduate degrees in addition to the medical degree that you hold. And I would love to hear from you a little bit about what motivated you to spend your time getting those degrees. I mean, clearly you love to learn, but tell me a little bit more about that.
That's a great question. I think you hit it right on the head. I love to learn, and I just had opportunities to learn at some very prestigious places and took those opportunities and ran with them. And every experience I had, I wanted to learn more. I started with policy, and I needed a little bit more finance, and that led me to the business, and then the business led me to some other pursuits and interests. And my wife and my family and friends know me well. They're asking me what's next. Maybe I'll go to law school or art school or something like that. So I just love to learn, and I just have always been an avid learner and curious by nature. I love books, and I just love the whole experience and the interaction. And each one of my learning experiences has fundamentally changed my life in so many ways. Not from what you think, not from sitting in the classroom and just doing the work, but from all the people I met and my classmates, my colleagues, my professors, and those relationships that I fostered in each one of those experiences have absolutely been, fundamentally profound in the way they've shaped my life and opened my thought and aperture for new and exciting things. So.
Excellent. Well, we are the lucky beneficiaries of that, as well as the fact that you clearly love to speak and share your thoughts around innovation. And we're really looking forward to hearing your remarks today. So thanks for joining us, and I'll turn it over to you for your prepared remarks.
Okay, thank you. All right. Well, we're going to go into a video screen sharing here. So there we go. The title of my talk today is called Accelerate 1924, very apropos for the theme of this august conference. And thank you to everyone that has not only contributed to the manifestation of this great event, but all those that will be watching after the event, and for the forethought and all of the insight that went into putting this amazing program together. It's really an honor to be here. I'm going to speak about how to survive and how to thrive in the era of health delivery innovation. And here we go.
Everybody has a purpose in life. Everybody has a destiny. And the knowledge of that destiny enables one to fulfill it.
My name is Dr. Hassan Teta. I'm a thoracic surgeon. It means I'm a heart and lung surgeon. I specialize in heart and lung transplantation specifically.
All doctors to the ER. All nurses to the nurses station.
So this evening we got a call for one of our transplant centers has a recipient that requires a heart, and the donor is a match, and so we're flying south to go recover the heart and to bring it back to the recipient. So there's a lot of coordination that has to go involved with that, because that particular donor is going to also be donating other organs besides the heart.
Because what we're helping to do is reconcile a great loss for a family that has tragically had a loved one pass away, and help them to find some meaning and purpose in that individual's life, and knowing that they are going to now be involved in gifting a heart or a lung or another organ to someone who's desperately in need of that organ. I think it provides a lot of meaning, and to sort of be in the middle of that is really an incredible feeling.
Left tab into the end of the metal buckle, then pull on the belt end to tighten. The belt may be released by lifting the top of the buckle.
Just under half an hour.
So we just landed, getting ready to go to the donor hospital. All right.
All doctors to the ER. All nurses to the nurses station.
I made some calls to our recipient patient, give them an update to let them know where we're at in the stage so that they can coordinate accordingly. And hopefully we'll get started here and have an assessment of the heart and then decide if it's going to be a good fit. I'll take it over here. The heart looks pretty good. We sent you some videos. We did have,
Systolic's been fine at 112, heart rate, like I said, 103 or so.
which we had to treat. And then we gave some amnio and a couple grams of mag and got electrolytes. The potassium was 3, so I think this could be related to that and just start being a little irritable.
To the video yet, or if you received it, but the heart looks good. Was this
Every second counts. We got the heart. Recovery went well. Everybody's dissected out their organs. The heart always comes out first. And now we're heading back to the airport. Flying back. So from the moment we cross-clamped, which was just a little bit over 30 minutes ago, about 20 minutes ago, we have about 4 hours to get the heart into the body and the recipient side. So that's why we're moving with a lot of urgency right now.
Oxygen masks are stored overhead and will drop down automatically if required.
And to be on the other side of that, and putting that organ in and having the heart, you know, sort of start beating again in this new person and knowing what that's going to mean for them, a renewed life, a full, you know, sort of future ahead of them. You know, to be involved in one of God's miracles like that, it's like it's just an incredibly rewarding experience. So each and every case is absolutely special to me because it reminds me of the moment in time where I, you know, came very close to dying and what that would have meant for my family and friends, and knowing that to be in the balance of helping a family reconcile this tragic loss, and more importantly, to some extent, make meaning of their death by gifting life to others, it really is, it's really something that always becomes meaningful, never becomes old. It's something that it always renews my energy and passion for wanting to do this even more and to make more opportunities like this possible, and to contribute to saving even more lives.
So I hope to start by, I wanted to start by showing that video to give you a perspective of my world in clinical medicine, but you'll also get to appreciate some of my work in the military as well. Because it's really important to, I think, begin with a purpose. Each one of us is certainly interested and working toward a purpose. Some are working toward finding that purpose, but for me, my purpose has always been saving lives. I love to operate. I love helping patients, and the work that we do in healthcare is just so rewarding. So a couple of objectives. I wanted to provide an environmental scan, and I think it will set us up very well for the future talks that are going to occur just following mine, to give you some thoughts and some motivation and ideally some inspiration in how to approach you know, the afternoon ahead. I wanted to focus on telemedicine just as an example, but just one example. And then I wanted to share a framework for success aligned with the title of How to Survive and Thrive. So we will, of course, define our current era of healthcare. I will use a novel technique to do that, focus a little bit on telemedicine. And then I will share some frontline lessons that I learned in the deserts of Afghanistan. I'm the tan fellow with the shades there, in case you wanted to see who I was. This is a picture of our group deployed to Southwest Afghanistan several years ago with our medical team. It was one of those, again, transformational experiences for me, and one that has shaped my life for the good. So what's the current state of healthcare? Well, healthcare spending, of course, as everyone knows, is projected to big expenditure for us. And just by the next couple of years, it could be as much as 19.3% of our GDP, and some estimates have it even higher than that. Healthcare spending is projected to grow on average, you know, at a pretty significant rate, you know, well into, like I said, the 2020s. And worldwide, healthcare struggles with rising costs without proven value. Why do I bring that up? It's because I think I wanted to highlight the challenge, of course, you know, this behemoth of healthcare spending that is continually plaguing our system. I wanted to highlight the problem. Obviously, if we continue to spend so much money on healthcare, we can't spend it on other things that are very important to the government and society. And so I think what that does presents an opportunity not to necessarily cut the cost, but maybe increase the value for the cost that we are expending for healthcare. And so let me highlight yet another example of how this opportunity comes to fruition. And I think it'll tie in very nicely to how I began, with understanding what your purpose is and thinking about where it is that you work and how you work and finding opportunities to make that better.
There's a magic that's happening.
A few weeks ago, I was in the operating room. And I think this is why it's so pivotal to have practitioners develop these solutions alongside other professionals, because we have the perspective and the inclination to see what will work and what won't work. And while I was doing this case, which is traditional, the liver surgeon was taking a biopsy of the liver. We happened to be at a small hospital, and we have to wait for the pathologist to give us a reading on how much necrosis and fat is in the cells to see if the liver is going to be used. We waited for 4 hours because it was a small hospital and the pathologist was out and they had to get the tech, and it was ridiculous. And while I was there waiting, I was thinking about informatics and AI, like I always do. Really, what I was thinking about was, how can we make this better? That's what all of you do every day. How can we make this better, whatever this is? And in my question to myself, I said to myself, we are in medical imaging classification right now working on a project of delivering augmented reality microscopes that have been trained on algorithms to detect, in this case, cancer. By looking into the microscope, little rings get drawn around the abnormal cells. And I said to my colleague, hey, what if we had a microscope in the OR, or maybe down in pathology, that we could stick this liver slide in and we could train it to find out how much fat and how much necrosis is there, and then maybe we could telemedicine or just take a picture and snap it to the radiologist, so then we have to wait 4 hours and keep all these other recipients waiting. You know what he said to me? It'll never happen. I've been practicing surgery for 30 years. I heard about this AI stuff 20 years ago. And behind my mask, I had a big smile on my face. But I also recognize this challenge. We have to be evangelists, because our practitioners may not know what the art of the possible is.
There's a magic that's happening.
A few weeks ago.
So in thinking about that magic that's happening and thinking about us being evangelists, I think it's clear that there are many opportunities to innovate and to improve healthcare that will make a dramatic difference in the value that we glean from healthcare and the care that we provide, and ultimately save more lives and do it more effectively and efficiently. So I want to spend a little bit of time just talking about our era, the era that we currently are in. An era is a period marked by distinctive character, events, changes that before and after which the practices change to a significant degree. Now, I used to give elements of this talk before COVID, of course, and I think COVID is one of these fundamental life-changing events, global pandemic, that really illustrate and highlight how important an era is in terms of being this distinctive event, before which and after which the practices are significantly changed. It's important to recognize the dominant cultural and financial features of an era, and of course, this is perhaps the key, to adapt to the dominant cultural and financial features of an era. So it's very important to recognize that there's an era, and then it's very important to adapt to that era. And there's some trends. There's some trends that we should highlight. Certainly political trends, economic trends, and then of course there's social trends. So the question I would ask this audience is to consider this: what is our current era? Now, we gave some hints to what our current era is, but just think about that for a moment. And let's take a little bit of a closer look at what's happening now through an economic lens. Again, major trends, follow the money. Mentioned before, healthcare is a significant expenditure to the federal health budget. I spent a year at the Congressional Budget Office as part of my fellowship for the Robert Wood Johnson Foundation. Exceptional year, learning from economists and health policy experts, but really fundamentally understanding how impactful finances are to the policy and the ability to deliver services and help the people of a society. Finance is very important. To that point, you can see that Medicare, Medicaid, and of course even the exchange subsidies, which recently came on board, continue on a projection that is quite significant in terms of its percentage of the GDP. There are lots of events that I think open themselves up for opportunity, but also are helpful in terms of understanding what kind of era that we live in. Again, some CBO projections from my time there, and this is just projections for just a few months away, a year and a half away, people under 65. Before the Affordable Care Act, there was a significant number of folks that were uninsured, and maybe that number has dropped somewhat, but there still is a significant portion of the population that remains uninsured and potentially unable to access healthcare, especially when they need it. And there are changes. This is just representative of one well-known organization, but many organizations in the workforce are keenly interested in healthcare because it is one of their greatest expenses for their employees. It's a benefit that came from many decades ago, being offered by companies as a way to incentivize and entice and recruit great talent. And now it's become something that's almost expected in the workplace. But it is one of the greatest expenses that organizations have, and for that reason, companies like IBM and others are looking for how can they derive more value out of the healthcare dollars that they're investing in their employees, to extract health, well-being, and longevity out of the investments in health, as opposed to just paying for sick care. Socially, there are incredible amounts of strides that are being made right now in improved patient safety initiatives. I can tell you in surgery, many of the things that we used to do decades ago are just simply not done anymore, partly because we have this keen interest in making sure that the patient is always safe and that we're not doing any harm. There's a lot more patient-centered care. There's shared decision-making, and there's also, of course, patient empowerment through technology. So the trends are to do no harm, on steroids now in most hospitals. We also have gone beyond this sort of checklist, and you think about the top 10 causes of death just a few years ago from the CDC. Medical errors still remain pretty high, and so that's why there's this absolute vigilance in terms of how to make the healthcare that we provide to patients safer, more effective, and not contribute to a cause of death in the society. And of course, this cannot be understated enough. There is an incredible amount of empowerment to the people. We are all walking around with supercomputers, many of us anyway, right in our pockets that can help not only give us a lot of information, but can also help to provide a support to our health and provide a great amount of data to our healthcare providers to assist them in their work. And if you look at a political lens, it's very important as well, because you can't escape the fact that there are major trends going on in healthcare right now. A lot more transparency between physicians, the hospitals, group purchasing organizations, and of course the healthcare industry. Absolutely, healthcare reform always front and center with any major political debate, and that will never probably go away. And partly because it is absolutely one of the greatest expenses that we have as a country and as a nation, and it continues to go up, and it outpaces many of the other things that are very important to society, like Social Security, discretionary spending, and other mandatory programs. So for all of these reasons, it's really important, again, to understand what is the era that we live in, because it's important to be able to adapt to that era. I would suggest that this is the era that we're living in. The current era I believe we're in is the era of health delivery, innovation, and patient safety. And understanding that, as I'm suggesting this as an era, gives you, I think, a great perspective to understand and appreciate where there may be opportunities for innovation and breakthrough. So the title of my talk was Accelerate 1924, and many of you probably were curiously wondering, where does that come from? Well, listen to this. I'm from the future. Listen to me. This is the cover of one of my favorite cartoon caricatures. This was a cover from Radio News circa April 1924. So that's where the Accelerate 1924 comes from, because we're almost 100 years from when this image was depicted. Now, this is a 100% radio magazine. So you'll notice a couple of things that are very interesting. The artwork depicts a radio, not even a TV, a radio. And from that radio, you can see that there's a doctor, almost providing what we now, take for granted as telemedicine. So I just think it's a very novel and neat way to think about how people were thinking 100 years ago for a technology that didn't exist at the time. But here perhaps is the message to be gleaned from that. Your ability to learn faster than your competitors is your only sustainable competitive advantage for the future, potentially. The kind introduction asked the question about why do I like to learn? And I think it's because I have fundamentally believed that this is true, but I am just a naturally curious person. And I think knowledge and the application of that knowledge absolutely gives you a competitive advantage and brings a lot of joy and fulfillment in your life in every way. So what's the way forward? It wouldn't be fair to just simply highlight some problems, give you some suggestions for what era we're in, without giving you some potential practical tools that you can apply right now, this afternoon, and start Monday morning with a new perspective and a new lease on how you'll deliver healthcare innovation and perhaps deliver even greater value in whatever work that you're doing. So what's the way forward in the era of health delivery, innovation, and patient safety? Well, before I give you those answers, let me just highlight some super forces that are absolutely impacting every dimension of healthcare. And they're important to understand and have a contextual sort of understanding of where they are in the ecosystem of healthcare. And these are sensors, AI and data, connectivity, people, and of course, strategically applied health information technology innovation. Sensors are ubiquitous. They're all over. AI and data, I mean, you can't pick up a magazine without reading about AI and big data. And of course, our sponsor for this keynote is a forefront thinker in that space, an Olive. Connectivity. The ability we have to be connected, it cannot be underestimated. We can actually collaborate with colleagues all over the world in a time when that was not possible just a few years ago. And that, I think, gives us great potential to do great things. And of course, people. I never underestimate, nor will I ever suggest you underestimate the resilience, ingenuity, and just the tenacity of individuals to come up with a great myriad of incredible innovation and ideas and just solutions to problems that are really plaguing society. And of course, strategically applied HIT, health information technology. Telemedicine can actually replace lots of things. And there's a Medscape study that suggests that 15% of emergency room visits could be handled by telemedicine, 37% of urgent care visits, 15% of physician office visits. And this was well before the pandemic. I believe that those numbers would probably be dramatically more at this point in time because a lot of the barriers have been removed. The way forward in this era? Well, a lot of people like to quote Darwin, and I like to always look at what's before and after some of these quotes that are famous and well known. And for the Darwin quote, the so-called survival of the strongest, there's a lot more to it. And the context is it's not the strongest of the species that survive, nor the most intelligent, but it's the one most responsive to change. So again, going back to why is it important to understand what era we're in? Because you want to be able to respond to this era. You want to be able to adapt to this era. You want to be able to survive, but you want to be able to thrive in this era. So those that are responsive to what's going on in terms of the changing and adapting and changing their practices to this era, I think are going to be the ones that are going to be well ahead and poised for success in the future. Not to mention those that learn faster than their competitors. And that's what you all are here doing right now. How do I suggest you thrive? It's not only enough to survive. No one wants to just survive. Everyone wants to thrive. Well, I'm going to provide and share a framework that I learned while I was in one of my graduate studies at the Kennedy School. I was fortunate enough to meet the author, the author as well as the professor, Howard Gardner, during my time at the Kennedy School. And one of his books, among many that I really loved and continue to read, in frequent occasions over the years, is his book called The 5 Minds for the Future. And it struck me because it immediately drew my attention to wanting to know, well, what do you have to know to be successful in the future? And he provided a framework, 5 minds, as he called it, which were five kind of things that you should be honed in on to be successful in the future. So I immediately gravitated to it. He talked about having a disciplined mind. I started this talk with sharing a video which highlights my discipline: cardiac surgery, thoracic surgery, and specifically heart and lung transplantation. That's my discipline. And he suggests to be effective and successful in the future, you should spend that proverbial 10,000 hours, those 10 years, getting really, really good and expert in something. Ideally, something that society wants and needs, and something society will pay you for, because that'll bring you lots of joy and benefit and set you up well for the future. So have a discipline, meaning something that you are really good at, something you're expert at, ideally something only you can do and do so well that people will pay you for it, is a good thing to have. He talked about having a synthesizing mind. What that means is having the ability to synthesize a myriad of data. We have so much information that comes to us on a daily basis, but having that information does not mean anything unless you can synthesize it, distill it, and use it and apply it to your work and your problem set, and to benefit, those clients and folks that you're taking care of with that information. He talked about having a creative mind. Now, that immediately was something that I was really interested in. And it's not the creativity that you might be thinking of, although it is important with the arts and music to be creative. But what he meant by creative is making connections. And I am always fond of saying that the way that one defines innovation is creating the right solution for the right problem at the right time. And that is really the essence of being creative, making connections. If you think about the canvas and the brush, you think about the percussion and the drum, these are really connections. It's just art form to another level. And that's what he meant by being creative. Of course, you have to be respectful. We're living in a time and an era right now where there is a lot of differences among people. There's lots of different beliefs. There are lots of different persuasions. There are lots of different social backgrounds, political backgrounds. You have to be respectful for all of these folks that have these different backgrounds that are maybe fundamentally different than yours, because the world that we live in is so connected right now that you have to be respectful that. Not only respectful, but tolerate and also learn from those differences, because it may open up your mind to a whole new way of thinking. And of course, being ethical. Beyond the obvious of what that means, he meant it in a different way, in a way that in healthcare in particular, we know that we have been given great gifts. We've been given great knowledge. We've been given great experiences. And it's our ethical duty to pass that knowledge, skill, and information to the next generation. And that's what he meant to be when he said, be ethical. So those 5 minds of discipline, synthesizing, creative, respectful, and ethical mind, if you have those things and hold those at the forefront, you will no doubt be successful in the future. And I believe Howard Gardner, in his brilliant framework, really gives us the way forward for how to thrive. And then, of course, I couldn't help but throw in, how do you exceed expectations? And you have to not only thrive, not only survive, but how do you exceed expectations? And it's a really easy thing to do. And I think it goes down to caring. This is pictures of me in the desert of Afghanistan. I shared that picture in the beginning. At the frontline lessons, what I learned was that teamwork, caring about people, and having a purpose will always give you the ability to exceed expectations. So I also learned this nugget. He who wishes to be a surgeon should go to war, because it was during my experience, particularly in that desert of Afghanistan, that I truly learned how to be a surgeon with the devastating injuries that we had. And at the time, I had 3 goals. They were to survive, to improve, and to make a difference. And thanks to a great team, outstanding friends, great support, a mission, a purpose, and of course, the unwavering collective desire that we all had to care for those that were injured and wounded, we all exceeded expectations. I'd like to thank you all for your attention and look forward to the rest of the afternoon. And I do believe that we are on a great path forward to accelerate innovation in every way. Thank you.
Thanks so much, Dr. Teta. That was a great speech. And let me take a minute to thank you for your service. It appears, at least from my viewpoint, you met your 3 goals, and very grateful that you did, and we appreciate your service. I loved your 5 super forces, and you talked a little bit about data and insights, and in our industry, we haven't really had our clinical data in a way that has been so accessible before. 10 years ago, almost all of our clinical data was still on paper records sitting on shelves in hospitals and physicians' offices. And it's really only been in the last 10 years that we've seen this tremendous change to electronic records, where we now have lots and lots of clinical data available. I wonder if we could just have you take another minute or two and maybe share with us, from your viewpoint as a physician, what are you seeing in terms of insights that you can get from data, either specific to your field, your surgeries? Are you actually seeing some of the data making a difference in your day-to-day work as a surgeon, or what other areas do you feel we're starting to get some real insights and the ability to use some of that data to improve safety and patient care?
Another outstanding question. I absolutely. I think the ubiquity of data. It's all over. It's all around us. It is great in one way, like you said, that the fact that we can now access that, because before, when it was handwritten, especially with some of my colleagues and myself included, with our unintelligible or unintelligible rather handwriting, it was hard to glean any information from that. But now that it's in this sort of digital format, it allows us to curate the data. Now, I do believe that we're sort of at the infancy of actually leveraging that data to give us insight and to give us the real meaningful information that we'd like to really get from it. And what I mean by that is, if you think about all of the health records and all of the information that's collected, it's a lot of stuff. Now, you have to make sense of that. And that's why I think Howard Marks's framework is so key, synthesizing that information. Well, in order to synthesize that, you have to have it labeled appropriately. You have to have it sort of in a structured format. And so what you're seeing in machine learning and the algorithms that we're building in the AI space right now is this adoption and understanding of, and a better understanding and a better appreciation of how to structure that data and make it what I like to call AIzable. And that's a frame, a reference I take from one of my colleagues at the VA, who's a brilliant AI scientist. And he talks about making data AIzable, or AI-able is really what it means. And that takes some time, and we're getting better at that. And I believe once we do, we're going to start seeing a lot of information come to us that's not going to be just a bunch of information without any meaning, but we'll start to see a lot of meaning. Better therapeutics for cancer patients that are specifically honed into that individual, better population health data, better ways and algorithms in which you should apply different techniques to teach and to treat different kinds of patients. So I think as we get better at structuring that data and getting more insight from that structured data that has been trained and has been sort of applied with machine learning, I think we're going to start seeing a lot better information come out of that. And one last thing I would say, it's not just the word data, right? It's not just the information, it's visual data as well. You saw the example that I highlighted with our work in the microscope in that imaging field and spectrum. We have an incredible potential there to really enhance our diagnostic capability in almost all of the ologies, wherever there's film, imaging, and sort of pictures and photos that are collected. Because over time, in better structuring, we can start to see patterns that machines can help us give some insight into to improve our diagnostic skills.
Wonderful. Thanks so much, Dr. Teta, and thank you so much for joining us today.
Thank you.
So we have a full agenda for the remainder of the day, filled with lessons from real-world experiences and stories of inspiration. We're going to continue with some practitioners from health systems across the state, sharing ways that healthcare providers can be involved in the innovation process. And we're also going to have a session about, should I start a company, to explore the development of new technologies and when a company is needed. Additionally, we're going to discuss different funding vehicles and strategies, and we'll have a special funding announcement later in the day. And last, we will hear firsthand from practitioners about their specific innovation journeys. So let's go ahead and get started. I think we have a vignette up for you next.
There are many on-ramps for clinicians to get involved in the innovation process, regardless of whether they want to become an inventor, join a team, or start their own company. While some clinicians may be interested in participating through the entire problem to product lifecycle, opportunities to make a valuable contribution also exist for those who would rather be involved in only a segment of the innovation process. Interested in dipping your toe into the world of healthcare innovation, but not ready to take the plunge on your own? We asked some clinicians to highlight different ways to participate in the innovation process.
My name is Dr. Janet Harris Hicks, board-certified urogynecologist with First Health Urogynecology, First Health of the Carolinas in Pinehurst, North Carolina. There are many ways to participate in innovation as well as advancing the field of medicine without having to actually invent a new product yourself. Multiple ways, including participation in clinical research that may be industry-sponsored within the United States, or they're outside by industry that's looking to bring new products to the United States. Also, as serving on advisory boards for industry. Many times industry looks towards the experts of clinicians in the field of medicine, physicians, nurses, technicians, to guide their next step in bringing new products to the market. Remember that in the field of medicine, we are those that first touch the patient. So we, in essence, hold expert opinions because of our everyday activity and that direct connection to patients. Bringing that to industry to then apply that in a clinical manner to patients is unique and recognized by industry. So it's important to capitalize on that specialty that you hold and that view of what is important to your patient, what is the needs in applying that healthcare in the most efficient and proficient manner with the highest level of safety and highest quality of care possible.
Hi, my name is Eric Anderson. I'm an ICU nurse at WakeMed. I'm also working with the WakeMed Innovations Department as a clinical liaison there. And I've been part of the inaugural Johnson & Johnson Nurse Innovation Fellowship. Recently, I just finished up a master's program at UNC and NC State in the Joint Department of Biomedical Engineering. It was focused around innovation in the healthcare arena, specifically with device development. And one of the things that I really appreciated was you can be involved in the process of innovation without being somebody that creates the new next best device. As a student, we were working with clinicians, the folks that are on the front lines that are delivering the healthcare and actually the ones experiencing the problems or finding the inefficiencies all day, every day. The clinicians and the providers that we spoke with weren't necessarily having to come up with the end result product, but they were critical in making sure that we were addressing the problem that was actually an issue they were facing and one that, if solved, would be a useful improvement for their care delivery.
I'm Becky Fox, Vice President and Chief Nursing Informatics Officer for Atrium Health.
So one of the ways that you can get involved in innovation is trying your hand at things like a hackathon. It's a great way to meet like-minded people, come together, work on a solution, and really find out where your skill sets and your passion are. Another thing that you can do to get involved is become a super user, volunteer to be an expert in one of your project rollouts, and really get involved in your informatics councils at any of your facilities where you might be working.
My name is Sandy Grewal. I'm an internal medicine physician at Novant Health, and I'm also leading a project on artificial intelligence at the institution. Many people may want to test these new ideas. There are early adopters who like to test ideas, and that is their passion. And then there could be people who would like to implement these ideas in the real world. And these are our administrators and executives who are interested in innovation. So innovation is a teamwork. Innovation is not one man do it all. You can participate in any stage that you want to.
Good afternoon, everyone. My name is Meg Powell. I'm the founder and CEO of 501 Ventures, based here in Chapel Hill, North Carolina. And as a serial entrepreneur, I've been asked and asked myself this question many times over the last decade, which is, should I start a company? And so we have put together a fantastic panel today to kind of beat this question up, as well as the answer to that question is yes, some of the additional questions that will follow very quickly. Before we get started, I just want to thank our sponsor today, which is SBTDC. It's one of our ecosystem partners here in North Carolina. The Small Business and Technology Development Center provides counseling and educational services to small and mid-sized businesses. Most of their services are free of charge. It's sponsored as an extension of the UNC system through a cooperative agreement with the U.S. Small Business Administration, with the goal of creating a positive impact on the North Carolina economy. So thank you to SPDDC and the work that they do in our ecosystem. So with that, I want to bring on our panelists, Mike Carnes from SPTDC, Krista Covey, who's the president of First Flight Venture, Travis Manasco, who's the chief medical officer at Bio54, as well as an emergency medicine and intensive care physician at Wake Med, and Ken Russell, who's the director of technology development at Wake Forest School of Medicine. So welcome to all of you. I'm thrilled to spend the next hour or so with you. Before we jump into questions, I'd love for you guys to introduce yourself just a little bit more to the audience. So Mike, if you're on the top of my screen, if you don't mind starting, that'd be great.
Sure thing. Hello, everybody, and thanks for having me participate in this event today. I'm Mike Carnes, Technology Commercialization Counselor and Equity Funding Specialist at the North Carolina SBTDC, and yes, it is a mouthful, and those who work here, it takes a little time, but we get it. I work with early stage technology companies primarily to help them raise capital to do research and development and commercialization of their novel technologies and products. Happy to talk to anybody in the audience about the services that we provide as an organization. We've got over 100 employees statewide, and we're throughout the state. So happy to provide support however we can.
Great. Thanks, Mike, and glad to have you with us today. Travis, I'm going to go to you next.
Yes. Hi, everybody. My name is Travis Manasco. I am a emergency medicine physician and intensive care physician at Wake Med Hospital. And I am a budding entrepreneur. I had an idea on a night shift, and over the past have started to develop it, and now I'm the chief medical officer at Bio54, and we're working to bring it to light. And I'll echo what Mike said. I am also available. If anybody has any questions about the innovation process for clinicians and what Dr. Ted has said about, clinicians are on the front lines and should be involved in, developing things for patients. So happy to help whenever I can.
Fantastic. Krista, if we can go to you next, that'd be great.
Hi, everyone. Sorry for the technical challenges there. My name is Krista Covey. I'm the president of First Flight Venture Center. So we are a business incubator located in the heart of the Research Triangle Park. We've been around for 30 years now, and we support what we call high science, high impact startup companies, all the way from the very earliest stages through growth and commercialization and beyond. And so we have different programming, educational programming and resources, mentoring, coaching, counseling. And we also have a prototyping facility located right next door called Hangar 6 for anyone that needs a prototype. Thank you so much for having me here today.
Great. And Ken, if you don't mind introducing yourself next, and then we'll jump in.
Great. Good afternoon, everyone. I'm happy to be here. I represent Wake Forest Baptist Medical Center, School of Medicine, and Wake Forest University. I'm part of Wake Forest Innovations, which is the tech transfer arm for all of those entities. I specialize in medical device licensing and digital healthcare licensing. Prior to my entrance into the tech transfer world, I spent over 20 years in orthopedics and spinal fusion devices as a medical device engineer and entrepreneur.
I think. Okay, perfect. I thought they had muted me there for a second, but great. Well, let's jump into this topic, guys. So, Krista, let's start with you. What factors should really drive the decision to start a company and around a new technology? You're obviously dealing with this every day as new ideas come through your doors. Tell us some of the advice you provide.
Sure, absolutely. And I do have a couple of slides if they're able to be shared as well. So when folks come to us for help, perhaps they've been working in a lab, perhaps they've been working in an academic environment, and they've come up with some new thing, right? Some research, some discovery. And the question is, do I turn this into a business or not? Is there something here? Well, it can be a pretty daunting task. Some of the things that I would recommend is, kind of figuring out where you are in that stage. And this is the slide that we use. I won't read everything to you all, but this is kind of how we gauge where our entrepreneurs are on their life cycle. So most of the time when you're in you're a napkin sketch or ideation phase, you're really still drawing out ideas. You're not sure if you should pursue this venture or not. There's a lot of leadership insecurity. And so those are some of the things that we talk with the innovator about early on. Where are you? Where do you see yourself? And then if you can go to the next slide, our goal as an innovation hub is really to help figure out how we can best support those entrepreneurs. And so we have something called Propeller. If you wouldn't mind going to the next slide, please. We have something called Propeller, which is a 6-week ideation cohort on the bottom right there, which really helps entrepreneurs figure out if they have a idea worth pursuing. Do I have a market? Do I have what it takes? Is the timing right? And do I have a business model potentially? How will I fund this? So those are all those questions that these entrepreneurs really need to think about. And that's what we do in our early stage program called Propeller. And so again, some of the things just to reiterate, especially on timing, is if we think about where we were in the 90s with the advice, hey, don't talk to strangers on the internet. Hey, don't get into each person's car. Well, now we have Uber, right? And so we're calling people up over the internet and getting in their car to go wherever we need to go. But that Uber was, they had the timing right. We're now ready for those types of ideas. So make sure that your idea has a market and the timing is right. Another thing on the timing is, do you have priorities right now, whether, you have a full-time job or a family or other responsibilities to start a company? That's a big undertaking. It takes a lot of blood, sweat, and tears a lot of times. So make sure that the timing is right for you personally. And if it's a challenge, one of the things to overcome that is to build a team. So perhaps you want to still keep your clinical hours or your office hours and let somebody else run with your idea. So that's something else to think about as well. And again, our job as an innovation hub is to meet with you no matter where you are in your stage of business and help you walk along that path to whatever success looks like for you. And not only First Flight, but we've got some wonderful folks here on this panel today that are more than happy to meet with folks and really think through those challenges when you're looking to start a company.
Thanks so much, Krista. I think you hit on a lot in a very short amount of time. But one of the pieces you talked about was timing. Is it right for you? So Travis, question for you. If a clinician is still interested in continuing their clinical practice, but founding a company is the right thing to do for the technology, what are some options that they can pursue?
Sure. And thank you for that. Those comments, Krista. A lot of those comments I'm going to just expand upon a little bit more. So a lot of, working in the hospital, and when people find out that I'm developing a new medical drug device combination product, a lot of people will then tell me their ideas. They'll say, oh, what about this? What about this? And then they'll say, I wish I could do it, but I don't have any time. And I get it. You spent your time becoming an ICU nurse. You spent your time becoming a cardiac surgery nurse practitioner or a radiologist. And now you're practicing it. And there's only so many hours in the day. And it's a very daunting task to then, okay, now I have this idea. Is it going to work out? Is it worth my time? What do I even do? And so there are multiple different options you can do. I think the first thing I'd like to, for any kind of clinician innovators out there, I will say, I bought a book off Amazon on how to start a business, and it was the highest rated one. And I get no funding from it, but it really helped lay out just the basics, because we've been training for X amount of years to take care of patients. We haven't been training to know what a non-disclosure agreement is, or know how to read a contract, or know how to, X, Y, Z. So getting a little bit of basic information and then learning how to protect yourself. One, do you have a good idea? Is it patentable? Is it defensible? And then two, do you have the basic knowledge? And then from there, if founding a startup is the best idea, I echo what Krista said. You can start a team. You can find a team around you. And luckily for this area, I remember when I had the idea for our product, I think I reached out to Krista. I think I watched Mike's. I went to a conference that the SBTDC had. I emailed the North Carolina Biotech Center, just trying to learn as much as possible. And then when you learn, you kind of figure out what else you can do. So you could license your technology. You could meet up with MBA students, assuming you have all protections in place. MBA students, maybe one of them is interesting in co-developing your project, and maybe when they graduate, they become your CEO. You could find a team and then form a joint venture, which Meg and I are familiar with, as we are. Meg is our CEO at Bio54, and so you can find people that can help you get this to patients. You can also reach out to the different innovations programs that hospitals may have, because they can help you set up. They can help you walk along this path.
Great.
And maybe I'll chime in on that too. I think really relying on the network effect and trying to resource your way in with folks who have built businesses before and can give you feedback on that is just absolutely critical. And we have in North Carolina, we have just an amazing ecosystem of support organizations, as we just talked about. And so really, reach out, connect, and talk about your needs. One of the things that I love about working with clinical innovators is the fact that you all have such a personal connection with the unmet needs and the problems that you're trying to solve in the marketplace. So whenever I meet with clinicians, I almost always know that they're really on to, a really nice product idea, because there's such an unmet need, and they're tapped into that value proposition. So, I think it's just connecting with the business folks and trying to understand the structure that goes around your company and how to move it forward, and know that, no company operates on its own. There's always a team behind the effort.
Yeah. I think that's a great point. I think the ecosystem here in North Carolina, especially, is not just is so large with regards to all the different opportunity groups, but also so collaborative. And I think that's something really special here that maybe you don't see in other parts of the country. But, even though they're distinct entities, there's really a sense of collaboration and making sure that they're all serving as connectors to get you the right resources that you need, both people, time, expertise, etc. So, starting a company is one avenue. Travis, you hit on this a little bit with regards to licensing as an option. Ken, ideas are coming in your office. How do you sit down and think about, helping clinical innovators talk about, maybe a licensing path is a better path than actually forming a company? So tell.
Certainly, I'd love to speak on that. First off, we do encourage our faculty and staff that would love to be entrepreneurs to do that and pursue that. So we do have multiple startups, usually in any given year, that people like to start with, and it hits on a lot of what Travis and Krista were talking about and how they do it. But from a licensing point of view, and I get to work with clinicians and nurses and staff who are on the front lines every day, and a lot of the medical device ideas are product improvements to things that are already out there that they're currently using. A lot of times they're collecting data on the products that they're using and learning how from that data to make an improvement. So if it's a product improvement, if it's something that is already in the marketplace and it is a device that can go through a regulatory substantial equivalence filing, then those make for good licensing opportunities. Typically the things that require clinical trials, like a de novo 510K through the FDA, or require a full-on investigational device exemption, those lend themselves more likely to starting a company to require several rounds of funding to get through that. But in those cases where you're having product improvements that are regulatory substantial equivalents, we've had really good success licensing those types of devices. One of the things you want to do prior to approaching a company is you want to protect your idea. You want to protect, what you have. And when we think of protection, we jump right to a patent, for example. Well, filing a patent application is certainly one of the ways to do it. But you also have to keep in mind that there's the know-how behind the apparatus. If you're building a new medical device, there's know-how there, and you need to be sure to identify that as a trade secret, so that when you start discussions with a company, you don't just give away the secret sauce, so to speak. So you have know-how, you collect data, and then you can file for a provisional patent application to protect if you would like to do so. And then how do you approach a company? Well, one of the ways we do it at Wake is we go through strategic sourcing. Any company you want to license to is doing business with us. And so going through strategic sourcing, going through the sales force end of the company is a good way to get to the decision makers inside the company that would take a look at it from a licensing point of view. And not only may you get a license, but you may get, if it really is a very good product improvement to something they're already doing, you may get funding from them. You may get to do co-development. And those are the fastest paths for those types of ideas to get to the marketplace. So that's some of the things that we use, and we've had good success with that.
Fantastic. And just a follow-up question, Ken, do you find that most institutions have a group like yours that could help you start to think about, approaching these through strategic sourcing, or how do you see your colleagues across the state?
Well, I don't know. I haven't talked to a lot of them to know that they use that, but I would certainly encourage strategic sourcing to do that. Strategic sourcing can help you in a lot of ways. One is contacts into the companies. Okay, we just talked about that. But typically, strategic sourcing has arms called value analysis, which is the group that then looks at any new device and product that's going to come into the hospital system and make sure it has value to the organization before they add a new unit to purchase. Well, I find that very helpful because we use the value analysis to look at a new device when we're deciding if we want to try to protect it or not. Because we go to value analysis and say, if we had this new device, would you buy it? And what are the criteria? Well, the criteria typically are, they look at it from a price point of view. They also look at it from a safety point of view. Are you improving patient safety? Or are you improving the outcomes with this? And if you can get those kind of things answered through value analysis on your new idea, then that gives you more information and ammunition to go to a company and say, hey, our value analysis would buy this. You put this in your portfolio, we'll buy it. And if you really work with your value analysis and get an idea, they can give you an idea of what they pay for it. And you can give that to a company and say, as a whole portfolio of, we have a device idea, we have fleshed it out with prototyping, with drawings, and this is our value analysis assessment of it. This is why they would buy it, and this is a price point that they would typically purchase it at. And that helps round out your sort of licensing pitch to a new company.
Fantastic. So, Mike, as a serial entrepreneur, I think I've made this mistake at every company. But once you have decided to form a company, so you've made that decision, then you have a whole new set of decisions. Do you start an LLC? Do you start a C corp? Do you start an S corp? Qualified small business? What kind of structure do you put around it? And who in the ecosystem can help you do that? So, love your advice and thoughts on that.
Sure, I'll do my best. So, if you're at the point where you've decided to create a legal entity around this effort that you're pursuing, maybe it's because you want to, capture additional value over what you would be able to get from a licensing deal, let's say, and you want to have control over this as an opportunity, and maybe the only path to advance your technology at this point is to create a business. There are a number of options that you could choose from when it comes to creating a legal entity. But the high level thought process here is that a legal entity, a corporation or LLC, limited liability company, are going to create limited liability for yourself and for your company. And so it creates a legal separation between your company's finances and your personal finances. So if the company fails, there's not a huge risk that your personal assets are going to be pursued. So that's why in theory you want to create a limited liability company or corporation. But with any of these different types of entities, there's certainly going to be pros and cons of what you would want to create and start, and that's really going to and you really want to talk to corporate counsel, attorneys, or tax consultants to help understand what's going to make the most sense in your particular situation. So that's the first thing I would say. This really does get into the realm of legal and tax counsel, so you'll want to make sure to talk to them. But in general, when you think about technology companies, usually what I see when I work with a very early stage effort or somebody who's still thinking about going into business, usually the companies we work with will either create an LLC or a corporation. And so I kind of, when I think about the decision process that they have, it usually boils down to a few different categories. But I think some of the important ones for technology entrepreneurs to think about are taxation, whether and how you're going to finance your business. So whether you're going to need to raise investment dollars or not. And then thirdly, kind of corporate governance and the way you want to operate your business. And so, when you think about those different categories with a LLC, typically that's a little bit more favorable from a tax perspective in most cases for founders starting out a new company, because they can pass through taxation into their personal finance, to their personal tax return, so you can write off losses, et cetera, as opposed to a corporate tax, which is going to be double taxation and some other things that will be a little more costly with from a tax perspective. But when it comes to raising capital, so most companies that I work with are going to be they're going to be bootstrapping their companies initially, maybe some combination of non-dilutive funding through grants like the SBIR and STTR programs, other regional grant programs, or they may be self-financing the business for a while. But if their ultimate plan is to raise, angel, professional venture capital, or angel financing, then an S or a corporation is really an entity that's going to be better suited for accepting investment from investors. And typically, professional investors would hope to see that a company is set up as a Delaware C corporation, and there's a lot of reasons for that we don't have time to go into now. But the timing of when you plan to raise money can go into your initial decision of whether or not you do an LLC or a corporation. There are, S corporations, which allow you to have taxation that's more similar to an LLC if you're a corporation, and that's another consideration. But again, that has some restrictions on the types and numbers of investors that you can have. And then the last thing is corporate governance. So, when you think about different entity types, an LLC has a much more flexible corporate governance, I would say, where you have the ability to create an operating agreement, and that operating agreement usually is going to, give you a lot of optionality in the way you run your business. Whereas corporations are governed by corporate bylaw, which is standard. You're going to have a board of directors that's going to be in charge of making decisions on behalf of shareholders of the company that have fiduciary duty to the company, with the role of hiring and firing the CEO. And so investors also prefer corporations due to that feature, which is higher predictability in the way the corporation's governed, and also professional investors like to get a seat on your board when they make their investments. So that's just something to keep in mind. Also remember that it's typically not be all end all. You can start out as an LLC. I have lots of companies and clients that I work with that started out as an LLC because they thought that would be more advantageous in the early stages. Then when they got ready to start raising capital, they convert to a corporation. That's completely doable. It's harder to convert from a C corporation or from a corporation back to an LLC. So you don't want to do it that way. But in general, it's pretty straightforward process to go from an LLC to a corporation. So that's just a few things to think about. But again, you always want to talk to your advisors about these decisions early on. And if you have multiple team members, there's other implications as well. Maybe we can talk about that later.
So question back to you, and Krista, you might want to jump in here too, but how do you find that corporate counsel? I mean, do you guys provide lists, recommendations? How do you help match people with their attorneys?
Yeah, I've built relationships with folks over the years and have a list. And I work for a SBA funded organization, and so we're not allowed to give you one name or anything, but we have a great list of people who our clients have trusted over the years, and be happy to share that information with you.
Great.
Yeah, same thing here. We have a list of folks that have been that we've worked with in the past, and we know do good work. We also have a group that we call navigators. There are mentors and our entrepreneurs in residence, and so many of them provide or have expertise in a particular area, whether it's legal or tax or others. And so we like to have a robust community of entrepreneurs that also like to talk with each other. So if someone has a need, we've got some opportunities for folks to say, hey, I use this person, or I had a really good experience here. And so a lot of that happens in the hallways, frankly. But we do have a wonderful list of folks that have been very helpful.
Yeah, and if I can add to that too, a couple points. So one is make sure you're talking to the right type of attorney for the right situation. So too often we see it where somebody talks to an IP attorney about startup stuff, or vice versa. They're talking to their cousin who's an attorney about intellectual property law. Don't do that. If you're going to be raising equity capital, make sure your attorney has securities law experience and knows what a 83B election is. That's a really good litmus test for whether or not they're a good attorney if you're going to be raising capital. So that's the first point. And then the second thing I'd like to do is put in a plug for the Biotech Center here. Biotech has a great Baton portal, which is a professional referral database, and I'm pretty sure there's legal referrals in there too, but certainly a number of different regulatory consultants, all kinds of folks that are going to be helpful to this cohort of companies as they're going through the process of starting up.
Yeah.
I think Mike's explanation of these disparate startup entities is just wonderful. Appreciate that in-depth explanation. I'd like to say that we have found that for our entrepreneurs that want to start companies, We typically work with LLCs, S Corps, or C Corps, and we let them, we work with them to give them advice on their governance, but also allow them to pick the best tax matters entity that works best for them. We actually have LLCs we collect K1s from and distributions from. It's very successful, and very, very happy with that. We do have a venture capital fund that's professionally managed by Pappas Capital in the Research Triangle Park area. And when they invest in companies, we typically, like Mike suggested, they prefer to use a C Corp, because typically it's a medical device that's going to require a Series A funding or more. And so we'll typically go with a C Corp in that kind of situation. Thank you. Good explanation.
Yeah. So lots of questions. And, one of the things I think everyone's hit on here is you can't do it alone. Team is important. So we've talked about an attorney and finding the right attorney for the right question, but a lot of time you need a lot of other advisors. Travis, I'm just curious, in my head, I keep going cha-ching, cha-ching, cha-ching. How do I pay for all these people, right? I'm just, as kind of someone that's done this, how did you start to think about how to get the right advisors around you, especially in the early days, to help you get the information to make some of these decisions and answer some of these questions?
Thanks, Meg, and agree. That was a great, Mike, that was a great summary. And I don't think that cha-ching is still present. I don't, 2 years like going on, it's just every email. But, when you're first starting out, I really just leaned on my network and then I was kind of shameless about emailing all the great ecosystem here. I emailed, like I said, the Biotech Center. We have, seems like every couple of months there's a great entrepreneur workshop around, with NC State, with UNC and Duke. There's such a great educational entrepreneurial ecosystem here that I would cold email people. I would ask for warm intros. So a lot of my clinicians may not know that there's something called a warm intro and a cold intro. And when you know somebody and you get them to introduce you, it has a lot more effect and people are more likely to respond. I had no idea what that meant 2 years ago. So I just started kind of reaching out to the network, and it's amazing all the really nice collaborative people that are doing similar things and they want, so you may reach out and then you have a 30-minute Zoom conversation or have a meeting and you learn about somebody that could help you do X, or their last company, they used this very reasonably priced attorney group or XYZ. And you just kind of start building the network around here and realize that a lot of people are trying to help you. And that kind of sets targets. So if it's a scientific advisor, if it's a potential board member, if it's somebody to help you with governance or somebody to help you, how do you run a business, all those things, it was really exploring the network.
And how did you think about equity? I mean, Krista, I'm going to kind of pitch this to you, but, jump in here. But, when you think about founder equity distribution, how do you think about that? But also, how can you use your equity to compensate some of these other advisors where you might not have cash to give them?
Yeah, that's a great question. And again, I would first say that, you want to talk with a legal advisor when you're distributing equity. But, it can be a great, oh, I'm sorry. I cut out a little bit there. Okay. But it can be a good tool. The main thing is to have an operating agreement. Are you all hearing some feedback? Okay.
Just a little. You're keep going.
So the main thing is to have an operating agreement. Depending on how you decide to distribute equity and who's involved, and we also you want to think about early on when you don't have a lot of cash but you have this equity. Just be careful with that. Get some advice. Talk to other entrepreneurs that have gone down that path where perhaps, I'm sure you'll hear a lot of stories where they gave up too much equity up front. And that caused quite a bit of heartburn, several years later. The other thing I just wanted to reiterate, going back to the whole ecosystem here. We have a wonderful ecosystem with folks that love to help. And so we've got, I mentioned our navigators, which are mentors, coaches, but they're experienced entrepreneurs. Many times they're serial entrepreneurs, and they volunteer their time and share wisdom, best practices, expertise, and their own experience for free. So again, I can't emphasize that enough before you kind of get into the anxiety of, well, how do I distribute the equity and how am I going to pay everyone? Do reach out because there are some wonderful folks that are happy to help. There's a lot of folks in the ecosystem that want your, entrepreneur success. That benefits everyone. So I'll just pause there.
Are there any rules of thumb with regards to founders specifically that you tend to see applied?
Yeah, I can add some comments there. I think it's a really important question, and something that comes up a lot, especially with inventors who may be faculty members at a university or maybe clinicians that have predominantly another job, and they're trying to decide how to split up this pot of equity at the beginning of the company, and especially if you have, assuming you have multiple co-founders. It's a really important topic, and not just from an ownership perspective, but the downstream consequences of the decisions you make today in regards to how you split the equity. And so, we work with all types of companies, and what the first important thing to decide is or to understand is that you never want to just have equity. Okay, so the owners of the business should have vesting schedules where they're vesting in their ownership over time. If you have advisors or mentors that you may feel are providing enough support that you want to give them a very small percentage of equity, they should vest that over time as well. And so the concept of just giving equity to people it's not a good concept. So they have to everyone has to earn it over time. And that can save a lot of heartburn later on if a situation turns bad. But in terms of how you split that equity, it really needs to be based on how you're incentivizing people to be involved with the business. And so you want to incentivize the people who are going to be most involved with the success of the company and creating shareholder value. And so it's really, really critical that you take that into consideration when you're doing your initial split. Who's going to be, full-time, all in, blood, sweat, and tears into the company? They're probably the ones that should have the majority of the equity in the company.
Great. So it looks like we have a question from the audience I want to pitch out here. How do I go about filling my team with expertise that I don't have if I don't have enough money to pay them? Travis, you hit on this a little bit.
It's like I sent them the question, I don't know, a year ago. I had that same question. It's you hear people like, you need an expert in this, an MBA, somebody that knows how to raise money, somebody regulatory people, and again, the cha-ching, and you don't have any money. You have an idea, maybe you've put something together in your garage or basement, but that's about it. And what you can do is incentivize equity investing schedules. And before I kind of go into that, just taking a step back, I remember kind of starting on this journey being so overwhelmed with, equity and board members and all these things, and you learn new things every day. And I think Elon Musk said it, you can learn anything on YouTube. And so you can go to YouTube and learn what is a vesting schedule? What are stock options? And I know for a lot of people that are in the business world, you may have learned this very early, but for clinicians, we have a lot. If we're employees, I had no idea what stock options were. I'd heard it a lot on, the TV, but so just arming yourself every day with a little bit more information, it'll take some of that anxiety away. And so if you're looking for expertise to kind of fill out your team, what you can do is try to get a meeting, talk to them under a non-disclosure agreement, and tell them about your technology and see if it's something they might be interested asking for advice. Ask for some advice from these people, and they may give you advice. They may not have any bandwidth to join you, but they may tell you, oh, I know somebody who is looking for something new. Or they may say, I know somebody that knows somebody, and you just keep following it, and you'll find people that you can work with and that are capable and that have bandwidth, and you can give them equity on a vesting schedule of this company that we have formed now, and then start growing, and then also on the side start learning, because it's a lot when you first start out. And this question really gave me a lot of heartburn beginning to use Mike's terms. So it was a lot of heartburn, but it will get better. You'll learn, and it's okay to fail and make mistakes, because I mean that's really how you develop the better business judgment.
Yeah, Travis, your comment about asking for advice. There's a old saying: if you ask for money, they'll give you advice. If you ask for advice, they'll give you money. And I think that tends to be true when you're having these conversations. Maybe one step farther when you're in the fundraising mode, but that's certainly been true in some of the relationships and best investors I've built long-term investing relationships with. It really started as like, how do I do this? What do I do? Showing some humility around what you don't know, and being very transparent about what you do. And people are always happy to help. And again, I think we're in an even more special ecosystem here in North Carolina because of where we are located, where people really are here to help. So another question that just came in from the audience: what about finding board members and advisors, and how do you know that they're the right people? So kind of building on that last question, but like, how do I know? How do I know that they're good? As a clinician, how do I know that this person who says they're good at fundraising is good, or marketing, or any other kind of skill set you're trying to fill in?
I think you have to check references. I think you have to vet. You have to be willing to make phone calls and send emails and vet what people say they have done. And don't be timid about it. You can do it in a nice way, but if someone is recommended to you as a board member or something of that nature, and for raising money specifically, they need to supply evidence that they've done that.
Yeah.
And you can ask for that.
Before you get married.
Yeah, exactly.
And I think to great comments from everybody here. To Krista's point that she just made, I mean, advisors can be a good way to date before board members. So if you can think of advisors as potential future board members, you can leverage that early relationship to see how they might be as a board member and whether or not you're on the same wavelength. So that's something to think about. And then, in terms of board composition in general, early on when you first start your company, it's probably going to be founders on the board. The composition is going to really start changing as you bring on investors. And that's, once you raise a round of equity capital from professional investors, you'll usually have a neutral board where you'll have, 2 people from the company side, 2 investors, and then a neutral board member. And in general, that's, you're looking to have a balanced board of talent, both, in medical device. Let's say you want to have technical as well as regulatory expertise on there, maybe hopefully somebody who's had some experience raising capital. So look for where you have gaps and use your advisors and board members to fill those gaps.
Yeah. I think that we could probably have a whole panel on effective use of boards, right? And how to assemble a board, and how do you think about them as counsel, not just a check the box exercise that your operating agreement says that you're going to do, and making sure that you put those right people in, and that those people change because the company's needs change over time, right? As Mike, you just did a great job articulating.
And I actually, just real quick plug, I recently saw a presentation that was put together by the Angel Capital Association about boards and board structure. That was a really good presentation. So maybe we could dig that up and I can share it afterwards. But Angel Capital Association is a national association of angel investors, and they have a ton of good information and training.
I
Fantastic.
believe they have something coming up in October as well with the Big Launch Challenge on the 13th and 14th, and they have a whole series on and learning how to invest and what angel capital actually is and what it means for a company. I mean, it's just a great resource. So,
fantastic.
I want to chime in on that.
So I love these questions from the audience. Here's another one. Are there any programs that provide student support to companies or free services to startups?
Well, here in Winston-Salem, and I'm sure across the state, there are others too. There's one great organization here called Flywheel, which I know is across the state and Raleigh and other places. They provide sort of a communal service for entrepreneurs where they can share services with other companies and other like-minded folks. We have that. We also have a really wonderful program here in Winston called Winston Stars that was started by Don Flo, who is over Flow Motors group, who has been chairman of the board of Wake Forest Baptist over time and so forth. And that's a wonderful organization where he provides through other entrepreneurs, retired entrepreneurs, local executives that came out of Hanes Brands, for example, RJ Reynolds and so forth, and they help mentor companies, and they have a criteria for selecting companies in that. And we've got a digital healthcare company that just was accepted to that called Empath, which is a company that actually boosts the pre-screening of very deadly diseases for patients as a digital healthcare startup that's coming out of Wake. It's going into Winston Stars. So there are organizations, and I'm sure, in the bigger markets, Greensboro, Raleigh, you've got Launch Greensboro and so forth. So there are lots of organizations to look into across the state.
Mm-hmm. In fact, I'll just chime in, First Flight, we have lots of free events. We have virtual and in-person education sessions, workshops, and there are many others, on this panel and elsewhere that are happy to help support student innovators and entrepreneurs. Lots of great resources.
Yeah, and the SBTDC, as I mentioned, we're housed within the UNC system. And part of our mission is to, bridge the entrepreneurial community with university resources. And also we have an educational component of our mission that's associated with students. And so I think on an annual basis, we have over 200 student interns from across the UNC system, from Cullowhee to Wilmington, and we put those students to work with companies. So definitely reach out to me or your local SBTDC office to get more information about this.
Fantastic. Well, guys, as we wrap up, I just want to say a big thank you to all of our panelists today. Obviously, a lot of different perspectives, but all part of our ecosystem that we've talked about, this collaborative ecosystem that wants to see innovation thrive. So I'm sure all of our information will be provided if anyone has direct questions after the panel. So with that, I want to just for some logistics, we're going to have a short video, and then there's going to be about a 10-minute bio break. I think the next session starts in at 1:20. I just want to thank the 10-minute break is being brought to you by Geno Medical, which is a digital health company and nationwide specialty group that's leveraging their platform and digital infrastructure to enable access to virtual genetic care. That sounds pretty interesting to me. So I'm going to have to look into them more. So anyway, I want to thank our sponsors, thank our panelists, thank our participants, and keep innovating, guys. Take care.
Thank you.
Thanks, everybody.
In the 1980s, North Carolina saw the coming shift from agriculture, furniture, and textiles to a knowledge-based economy. Our visionary leaders targeted life science. To create a thriving ecosystem for this emerging field, we bolstered our traditional strengths, recruited key researchers and companies, and built a foundation for sustained economic growth. Biomanufacturing jobs followed. University technology powered dozens, then hundreds of startup companies. Our full complement of support companies, unique partnerships, and skilled talent continue to attract companies today. In 1984, we established the North Carolina Biotechnology Center as the transformational catalyst to move the ecosystem forward. North Carolina has grown to 725 companies with almost 65,000 employees, producing more than $83 billion annually in economic activity. And we're number one in manufacturing vaccines and potentially curative gene therapies. Our state continues to transform, creating jobs, healing patients, realizing our vision to be a global life science leader. As Governor Jim Hunt and Governor Jim Martin so aptly expressed, no other state or country has established such a comprehensive and effective model to stimulate biotechnology development. Celebrating 35 years of life science transformations in North Carolina.
Most people think of genetic testing as a mail order kit that helps you discover your genetic ancestry or common conditions. But in order to unlock the vital information within your genome, you need more than a single test. Inside your genome, that complex code that runs the systems in your body, exists more than 20,000 genes that are indicators for genetic conditions. And the medical industry has developed over 75,000 tests to identify different ways genetics can affect your body. That's good news when you consider that 10 to 20% of the world's population carries at least one of 6,000 known genetic diseases. The bad news? Finding your way to the right tests on your own is extremely complex. At Genome Medical, we simplify things for you by helping you and your doctor navigate this complex genetic testing landscape. We connect you with genetic specialists who can evaluate your medical history, health risks, and select the correct tests for you. Once your genome is tested, we don't just send you your results. We help you interpret them, answer your questions, and guide you toward a healthier future so you can take action. Most people are referred to genetic testing after exhibiting major signs of disease or after being diagnosed, and some only if they have a family history of genetic disease. But even a healthy family history doesn't paint a reliable picture of your own genetic health, because every person's genome is unique. Being proactive and consulting with a genetic specialist could potentially save your life or a loved one's. Because your genetic journey didn't begin with you and doesn't end with you. Knowing what genes you may pass on or have been passed to you can help you make decisions in the future. These roads to genetic health are complicated, but you don't have to travel alone. Genome Medical is the first nationwide medical practice specializing in genetic health. We evaluate your genetic risks, recommend and order the appropriate tests, and help integrate the results into your care, while guiding you every step of the way with a personalized clinical care plan for you. Isn't it time for you to get on the road to a healthier future? Genome Medical. people think of genetic testing as a mail order kit that helps you discover your genetic ancestry or common conditions. But in order to unlock the vital information within your genome, you need more than a single test. Inside your genome, that complex code that runs the systems in your body, exists more than 20,000 genes that are indicators for genetic conditions. And the medical industry has developed over 75,000 tests to identify different ways genetics can affect your body. That's good news when you consider that 10 to 20% of the world's population carries at least one of 6,000 known genetic diseases. The bad news? Finding your way to the right tests on your own is extremely complex. At Genome Medical, we simplify things for you by helping you and your doctor navigate this complex genetic testing landscape. We connect you with genetic specialists who can evaluate your medical history, health risks, and select the correct tests for you. Once your genome is tested, we don't just send you your results. We help you interpret them, answer your questions, and guide you toward a healthier future so you can take action. Most people are referred to genetic testing after exhibiting major signs of disease or after being diagnosed, and some only if they have a family history of genetic disease. But even a healthy family history doesn't paint a reliable picture of your own genetic health, because every person's genome is unique. Being proactive and consulting with a genetic specialist could potentially save your life or a loved one's. Because your genetic journey didn't begin with you and doesn't end with you. Knowing what genes you may pass on or have been passed to you can help you make decisions in the future. These roads to genetic health are complicated, but you don't have to travel alone. Genome Medical is the first nationwide medical practice specializing in genetic health. We evaluate your genetic risks, recommend and order the appropriate tests, and help integrate the results into your care, while guiding you every step of the way with a personalized clinical care plan for you. Isn't it time for you to get on the road to a healthier future? Genome Medical.
At the end of the day, it takes access to capital to advance products and technology. So, we asked some North Carolina investors for their perspectives on what makes for an attractive investment.
I'm Chelsea Ashragi, the Managing Director of the Carolina Angel Network.
Hi, I'm Mark Friedman. I'm president of RTP Capital Associates, which is an angel investor network in Research Triangle Park, North Carolina.
Hey everyone, my name is Tim McLaughlin. I'm a partner at Co-Founders Capital.
Hello, I'm Greg Brown, the administrator of Charlotte Angel Fund.
This is Mark Wadalik, East Carolina Angels for the North Carolina Biotechnology Center.
Co-Founders Capital we're investing out of our second fund, which is a $31 million fund focused on B2B software companies across the Southeast, but predominantly right here in North Carolina.
CAN's relatively industry agnostic. We invest in most all healthcare, except we try to stay away from therapeutics or anything with a very long development timeline.
Everything from medical devices to medical foods, nutrition, healthcare, healthcare IT, digital health, digital therapies, and even some therapeutics.
Charlotte Angel Fund is a generalist investor organization having investments in a wide variety of technology-driven companies. within the healthcare sector, we tend to look most favorably around healthcare IT, medical devices, and diagnostics.
When looking at a potential investment, I focus on the team. They need to be exceptional. They need to be passionate and coachable. I also focus on the business model. It needs to be scalable, and the strategy needs to be well thought out.
We love companies that have a demonstrable ROI. So when I look at an investment, if we were able to get a pilot with a software that we were to invest in, and we could see demonstrable ROI where we could do a case study from that pilot and take it out to reasonable business people, we could turn them, reasonable business decision makers, we could turn them into buyers and customers of our product. So I think that spans beyond just our software thesis, but investors that come and can pitch that demonstrable ROI solution.
We look for belief in the entrepreneurs that are coming to us. We want to make sure they see and believe in their path to success. They convince us of that path to success. They make us believe that. And trust in the entrepreneur is a really critical factor. We're going to be working with these entrepreneurs, hopefully for several years. And we want to make sure that we can believe in that entrepreneur and help them on their way to their success.
Our group is very focused on team as we look at prospective investments. That team has a number of dimensions. Part of it has to do with the founder group and their level of experience and ideally complementary rather than duplicative skill sets. A part of that team is the investor group as well. And we're looking to be aligned with investors who have commonality of purpose with us in terms of our goals and aspirations when we make an investment.
Obviously, for any investor, return on investment or ROI is always at the top of the list. But for East Carolina Angels, we're also looking for very passionate and committed founders of the startup companies that we invest in. We want to see people ready to roll up their sleeves, do whatever it takes to get the job done, to be successful, to bring in partners, to look for advice in areas they may not have expertise. Be willing to listen to our network, which is a diverse set of individuals with talents and expertise in a wide range of disciplines. And so we're really looking for companies in which it's not just money that people are looking for or companies that are seeking, but rather a partnership of aligned interests where we can come together in order to drive successful businesses.
Any red flags that come up in diligence, especially related to management, such as negative reference checks, big egos, or founder conflicts, would be a huge turnoff and would likely lead us to not look at the investment.
Obviously, the number one thing is trust in the entrepreneur. Are they being open and honest with me? If I don't feel they are, we're going to run. Other things include we need to have a full-time team in place. We don't invest in part-time CEOs. There has to be a plan for a full-time CEO. A startup is more than a full-time job. And then the last thing I'd say is, does the CEO have the ability to articulate their business to someone else? And if I'm talking to a CEO and in 5 or 10 minutes, I still don't know exactly what they do, we're probably going to run because that's going to hurt their ability to sell, to recruit, to raise their next round of funding. So you got to be able to articulate.
Right. Things that turn us off is somebody that's coming in and presenting and really just going through the motions. They haven't done their homework about what our group is or what we're looking for, why they would want to be partners with us, just making the rounds, going from everybody trying to raise money. And that really is a turnoff to the members that are sitting in that room. They want to know that that entrepreneur is coming to us because they see value in RTP Capital, so they see value in our members, and they want to be partners with us and they want us to be partners with them.
Particularly problematic for our group are opportunities where there are quite simply violations of the norms that are out there with regard to how things are typically done. That could have to do with corporate structure. It could have to do with structure of the financing round. It could have to do with valuation, how IP is held, whether that's in a separate company or in the operating company. But in general, we're looking for opportunities where the founder isn't trying to reinvent the wheel, but rather is doing things in a way that is familiar to us and that we believe are best provide the best opportunity for success.
There are certain things that probably would turn us off. These would include poor communications with the management team, poor follow-up, as well as follow through with things that we've agreed upon collectively in partnership. I would also say what's important is that a company is willing to listen to the expertise that we bring to the table and be willing also to strategically make changes along the way in order to be successful at the end. And those decisions, although not easy to make, will be done in concert with investors like East Carolina Angels.
Hi, everybody. This is Adam from Dream It Ventures. I'm hoping everyone can hear me. It'd just be great to get a confirmation of that. Awesome. Perfect. Well, welcome, everybody. I'm delighted to be here. I'm Adam Dakin. I'm the managing director for Dream It Ventures, and we're going to have a really fun and interesting talk about how to fund your endeavor, your concept, your entrepreneurial venture. As the old expression goes, no bucks, no buck Rogers. So unless you've got a very wealthy family or a super rich uncle, you're probably going to need some capital to fund your great idea. And we really got a terrific group of panelists that are going to provide insight on how to access that capital. Before we get started, I want to obviously say, sincere thanks. We're going to be talking about funding, but this wouldn't be possible if it wasn't for the generous support of our partners, NC IDEA. NC IDEA is an independent private foundation committed to empowering North Carolinians to achieve their entrepreneurial potential through a combination of competitive grants, programs, and a network of strategic partners. So with that, as I said, we're going to we've got a terrific group of panelists. I'm going to bring them into the room now. Ask each one of them to do a short bio on themselves and the programs or organizations they represent. Then I'm just going to take you through a few slides to set some context, and then we'll jump into the actual panel discussion. So with that, hey, how about we bring in Corey? And Corey, would you mind giving the audience a quick overview of yourself and your organization?
Hi there, everybody. I hope you guys are having a great day. Happy Friday. My name is Corey Allison. I am the CEO and co-founder of Calcor. We offer medical tape solutions to improve patient care and short-term management. Our clean single-use product is to address HAIs, reduce HAIs, and cross-contamination that can occur during intubation when a roll of tape is used on multiple patients. Also, I'm hate to say it, VC in my other life since 2011. And we have a small fund called the Jump Fund in Chattanooga, Tennessee. Mostly we have sourced from local women, and we are empowering women by using women's money. We focus on Southeast. We are industry agnostic, I would say, but we do really look for good teams to invest in. So that's my background.
Yeah, thanks, Corey. Good stuff. All right, Tracy Delaney, can you tell us a little bit about yourself and your organization?
Hi, I'm Tracy. I am with the North Carolina Biotechnology Center. I am in the Science and Technology Development Group, and we are the grants group. So our funding is to universities throughout North Carolina to advance their discoveries to research and to commercialization. So I've been in my role for about 5 years now. And before that, I was a consultant advising entrepreneurs and startup companies in the life sciences on how to find funding for your business.
So if you're an academic innovator, Tracy's probably somebody you want to be really nice to, get to know, send her an occasional Christmas card. We're going to talk a little bit more about that in a few minutes, on how to access some of those sources of capital. All right, Gerhang, why don't you tell us a little bit about your background in HealthQuest?
Thanks, Adam. It's great to be here. So I'm Garheng Kong. I'm the founder and managing partner at HealthQuest Capital. We are a healthcare-focused venture and growth equity fund. We manage about $1 billion that we partner with high-growth healthcare companies. North Carolina is near and dear to my heart. I lived in North Carolina for 15 years and still go back regularly, but hoping to spend some time on this panel and maybe find some companies that we can partner with as well. Thanks, Adam.
Awesome. All right, Rick Trum, you're up. Hey, Rick, we can't hear you.
There we go. Sorry. Yep. It's still that 2021 COVID stuff, man. It just won't go away, will it? Rick Shrum, I'm a Chief Strategy Officer here at WakeMed Health and Hospitals, longtime hospital and healthcare executive. But the principal reason I'm on the call today is also one of the founders of WakeMed Innovations here at WakeMed and our WakeMed Innovations Investment Fund. So happy to be on the panel and look forward to the discussion.
Great. Thanks, Rick. So you can tell we really do have a bang up panel here. Thanks all of you for doing this. And very briefly, again, Adam Dakin, Managing Director of Dream Ventures. My background is 25 years of health tech startups. I co-founded 5 companies, raised venture money for all of them. A couple went pretty well, a couple did not. And the jury is still out on the last one. And DreamIt is a Philadelphia-based venture fund. We focus on health tech, but predominantly medical devices and healthcare IT or software, predominantly late seed and Series A startups. And we've built out a really terrific network of partners, which includes large enterprise healthcare systems, several of whom are partners with NC Biotech. Shout out to Greta, who's not only done a great job organizing this meeting, but has been kind enough to make lots of introductions for my fund. And we've been at it for about 10 years. First check sizes are in the $750,000 to $1 million range. And at dreamit.com, you can learn a lot more about our fund and the types of companies that we invest in. I love working with startups and that kind of been doing it almost since I got out of school. It is my passion. Okay, maybe to set a little bit of context before we jump into this discussion about how to fund your endeavor. If we could bring up my first slide, that would be great. Okay. Yep, that's the topic today. We can go to the next slide. So it's really important for you in the audience. And we have a lot of sort of academic innovators, clinician innovators, and providers in the audience. It's important to realize that funding is generally stage-based. So what do I mean by that? And what is this graph really telling us? So on the x-axis here, we have 2 variables. On the green line represents the size of an investment. And along that green line are different sources of capital that you may be able to access as you move along the y-axis, which is really time and the stage of development of the product or the platform. And then the red line represents the risk, which is hopefully decreasing over time as we become a later stage venture. And as the risk goes down, we can access different sources, what we would call later stage sources of capital. You can see to the far right there, venture capital, like HealthQuest with Garheng. And then to the far left there is really the much earlier stage concepts, ideas. You really haven't sort of thoroughly developed a product yet. What's important to pay attention to here, and we're going to reference it throughout the talk, but you see the blue line there above the word traction. We're going to make a bit of a distinction here. It's slightly arbitrary, but I think it'll help with this discussion today. To the left side of the line, you see access to sources of capital are grants, friends and family. Grants include, SBIRs, military grants. Tracy's going to talk a little bit more about some of those in a minute or two here. But the buzzword that you all hear investors talk about, or buzzwords I should say, are product market fit. And if you ask 5 venture capitalists what that means, you'll get 7 different definitions. But for our purposes, we're going to try to context it as, if you're on the left side of that blue line, you're still developing your concept. It's still evolving. You're still either in the ideation phase or the market validation phase. You're doing a lot of customer discovery. You might even have prototypes at this point. But it's important when you cross over the blue line, that's where we talk about a product that has at least enough signals that customers will use it and buy it, and it works. Also, from an investor standpoint, there's a business model that we think is scalable, that you can distribute to lots of customers, you can supply lots of customers, and you have at least the capability to grow the business more rapidly. And there's a pretty clear distinction here, because when you cross over to the right side of that blue vertical line, that's when you can access what we call professional sources of capital, professional investors. Those could still be angel groups. There are professional angel groups, but more likely they're professional investors like venture capitalists, maybe family offices, for example. So different stages of growth, different sources of capital. A takeaway from this slide, though, that I think is important, particularly for clinician and academic innovators: through your network, your reputations, your academic pedigree, you may very well be able to get meetings with sources of capital to the right side of that blue line, while your platform is still very much to the left side of that blue line. You're still in the concept phase. You got a brilliant idea. Maybe you have an amazing discovery from your laboratory that you really think has commercial potentials. To be clear, it is very unlikely that you're going to get funded. Professional investors really are looking for some type of market validation, having some de-risking around the performance, the viability of the platform. So it's fine to go to those meetings. And a lot of people are generally polite. And if you are a pedigreed clinician, good chance that venture capitalists will be delighted to talk with you. But you shouldn't have the expectation that you're going to get funded if you're sort of misaligned stage-wise with this graph. Okay, next slide. And then another important distinction, I think it is important to separate out med tech, which we sort of think of as medical devices, and health tech, which I'm just going to sort of bucket into the software category, because that curve looks very different if you're a medical device versus a piece of software. So very briefly, what you see on the red line here is more for the curve in terms of valuation on the x-axis and different stages of capital and the amount of capital that you can raise on the y-axis here. But briefly, for a device, it's mostly about product risk, right? Does it work? Is it clinically effective? Can we validate that in a clinical trial? Can we get an FDA clearance or an approval and get it to the market? Is someone willing to pay for it? We can raise a significant amount of capital before we actually even have customers. That's not really the case for a piece of software. So you might have an amazing clinical decision support platform. It's going to be really hard to raise institutional capital to move to the right side of that blue line and access professional sources of funding until you actually have paying customers. Because for software, it's really about market risk, right? And so for traditional tech, it's all about market risk. So health tech sort of falls somewhere between that gray line and that red line. But from an investor standpoint, it is really hard to know whether there's a there, so to speak, with a piece of software, because the barrier entries are so low with a piece of software. So it's really hard to know until you actually have paying customers. And for software, that's kind of what we consider product market fit, where for a device, if you have great clinical data and key opinion leaders and people, surgeons, for example, who are willing to get behind this and it's already worked really well, that might be your product market fit. So hopefully that sets a little bit of context in terms of sources of capital and how investors think about risk and stages. So one more, next slide, very briefly. we have my fund online. We have a lot of terrific resources to help entrepreneurs avoid a lot of the mistakes we see. We listen to thousands of pitches every year. Startups make the exact same mistakes all the time. We've created an incredible library of content to help you, whether it's with your pitch deck or how to answer investor questions, how to put together go-to-market strategies, all those things. All right, we can take the slides down and we can jump into the Q&A. So, thinking about sources of capital, most academicians and clinical inventors are going to be to the left side of that blue line. You're going to start with an idea, maybe a prototype, and you're going to want to and you're going to need to find ways to fund that. So, Tracy, that's your expertise. Inventors, academicians, they've got this great idea. What sources of capital can you help them find?
We can help you find our grants. We can help you find national grants. We can help you find translational grants. We operate ourselves many grants to help academics get to that pre-product commercialization phase where you start learning about how to commercialize and how to do product development and get your team going. We can introduce you to the local I-Corps programs, of which they are an immense resource that we have here in North Carolina. We can also introduce you to our emerging company development team here at the Biotech Center, who can start those introductions to your other sources of capital. But we do a lot in the grants realm, from our own grants to SBIRs, which are really proof of concept grants from the federal government. And there are institutional grants as well from any number of foundations. Those are always great sources to look into when you're first starting out to develop your product.
And are there, I mean, you said as early as an SBIR for a concept, are there certain proof points you're looking for? Or, hey, I just, I got an idea on a napkin, I can come to you and you'll open up the checkbook?
No, we are definitely looking at early stage commercialization. So we are definitely looking for projects that have defined milestones, defined timelines. So you really start getting those fundamentals about product development. And we're really looking at translational research for the most part. We have a small grant. We have a micro grant that does more of those basic research. But for the larger translational research ones, we fund a grant that is designed precisely to get you to that SBIR stage or in concurrence with your SBIR, STTR funding.
Got it. Okay. So then as we kind of move up that curve, if you will, to different stages of funding, then we sort of come to you, Corey, right? You're not where Garhang is on the late stage financing. You're not giving grants either. So tell us what stage that you look to invest in, and what are the kind of proof points you're looking for?
Well, I look for, I guess I hate to be so repetitive, but the team, the entrepreneur. I mean, that's what's the most important thing that I look for. We actually, when we open up our kind of appointment and say, we're going to meet with you, we really do a lot of work even before to make sure that this is a team that we really want to spend time going through the process with them, because most of us at the Jump Fund, we are entrepreneurs. So that helps us understand all the heartaches that go into like getting there. So if we see that they have done their due diligence prior to even asking for a meeting, that's a check mark, right? I mean, they know what we're doing. They know who we're investing in. They know how we align ourselves with entrepreneurs. So we look for that, and we really try to find a way to have a win. Because our check sizes are so small, we really open up our black book to make sure that's what they're getting out of this relationship. So we open doors, we make introductions, and we talk about network. Maybe you're too early, but hey, if you have an opportunity, make sure you have that 1 minute elevator pitch ready so that when you see somebody that is a VC that you want to eventually meet, you're ready for that moment. So we look for that. We need persistent, ready to go entrepreneurs that are not scared of attacking big things.
Good stuff. You emphasized a few key points that I think were nicely articulated in the video that I want to highlight for the audience. It's always about the team, and that's kind of cliche, right? Every venture capitalist will always go, "Oh, we bet on the jockey, not the horse." It's true, even though it's very cliche. But it's very unlikely that professional investors are going to back a team that doesn't have full-time members. I think that was mentioned, right? Almost all of us look for a full-time committed, passionate team with skin in the game. The expression, we want teams that have burned the boats, right? They don't have it. They are all in. They're not still doing a side hustle for their day job. If you're a full-time clinician, are you really up all night losing sleep because your widget's not working the way it's supposed to? So that's something, professional investors put a lot of value on, because experience suggests that those are the teams that will, at the end of the day, execute. And at the end of the day, the idea doesn't really have that much value. An idea and $4 will get you a latte, right? At the end of the day, it's about how well you execute, move that concept to commercialization, right? So I think it is important to emphasize that. Garheng, you're sort of on the other side of the blue line, right? So you're a little bit later stage. So what advice sort of guide the folks in the audience, like when should they show up at your door? What are you looking for? And what sorts of de-risking milestones make something attractive to you? We can't hear you, Garheng. No, we cannot hear you. No luck. All right, maybe it makes sense to come out and come back in, and then we'll give it another shot here. In the meantime, I'll jump over to Rick, and then we'll come back to Garheng. Rick, within your system, I'm sure that very smart clinicians and innovators show up at your door constantly. What's the process within WakeMed when someone says, "Hey, I've got a brilliant idea for a new medical device," or maybe I even have a prototype? What's the process within WakeMed, and what advice or guidance do you give them?
Yeah, we enjoy a great platform to innovate from with extremely talented people. We really, when I look at your line, your blue line, and that whole journey that you showed us earlier, we really spread across all of those. And for our internal innovators,
we got you back, Garheng. Just a moment. Thanks. Keep going, Rick.
For our internal innovators, we will literally take them from an idea to from the very beginning to help walk them through the process. In fact, there were a couple of them, I think, participating in the program today that are internal innovators at WakeMed. Travis Manasco, Dr. Manasco is one of our leading intensivists here, and also Karen Sang, one of our outstanding nurses. Both are innovators within our system. So we give them a lot more resource and our staff time to be able to help them, get started, see if they want to start, a lot of real kind of early stage coaching. And then on the other side of that line, we do a lot of outside in innovation within WakeMed Innovations. Our sandbox that we have as a community-based hospital that does research, not a research hospital or an academic setting. We're able to bring in outside innovators into into our, patient care process and patient care network to be able to try out their products and services. And there's a little higher expectation there from the standpoint of how far along they are than the internal innovators.
Got it. Super helpful. Let's go back. I think, Gerhang, we got you back now, I think.
So can you hear me?
Yeah, crystal clear now.
Great. So I think it's interesting, right? There's always an evolution as these companies continue to grow and succeed. And I was sort of smiling when I was seeing Tracy, because I used to spend a lot of time doing early stage investing, and I was involved with the biotech center. And so, you spend all this time doing your PhD or whatnot, and you feel like you've done all this work, and the truth is you just got to the starting line when it comes to commercialization. And then you talk to Tracy, you talk to Corey, you talk to Rick, and you go through this whole progression. And at HealthQuest, for us, we're also, to be fair, just the stage of development, right? There's a public company life cycle after as well. But for us, what we're looking for at this point is, in fact, some commercial traction, right? So by the time we have partnered with companies, whatever it is they developed, whether it be a device or a diagnostic or an algorithm, it works. It's been approved. Somebody's using it. Probably somebody's paying for it. And so now you have some revenues, and now you really need to ramp it. And so this is a function of commercialization, sales, marketing, reimbursement, understanding how to partner, how to expand. Maybe it's in the US, maybe it's globally. We think a lot about channels and how to get our portfolio companies in front of all the health systems, in front of all the payers, whoever the right partners may be. And then we think a lot about value. Because most of the innovation that comes to market doesn't get full credit when it comes to market. They don't believe your innovation is as good as you hope. And so not with clinical trial data, but with real world data, we spend a lot of time showing support for those products such that they get valued by the physician or the payer or the patient. So we're investing on the low end, call it 15 million, certainly up to 50 is comfortable for us. We have plenty of rounds that we're pulling together 100 million. And these companies are really ramping, and they're growing from 10 to 20 to 40 to 80 million in revenue. And that's where we play. And then ultimately, hopefully these companies become self-sufficient or they go public. And then there's a whole new set of investors that show up as well.
So a lot of what you said really is commercialization proof points. I mean, and you mentioned they almost always have some traction. Is a couple of follow-up questions there. From the letter standpoint, is that a series A, B, or a C? Where does that fall into that sort of continuum?
Yeah, so it's interesting. I think that there's a stereotype, and then there's sort of the realities of it. I think stereotypically, probably it's a B, C, or D round. But to be fair, when a company gets to what we consider our starting point, which I just described, we have had companies that are 2 years old and have gotten to that starting point. And to be fair, they bootstrapped it. And then we just partnered with a company about 9 months ago that was 18 years old, and it finally got to the starting point for us, which is commercialization. And it might have been a series F or G or H or something. I mean, much, much farther down the path. So there's a wide range. And the other part, which probably many people are seeing, is the Series A is no longer the Series A. I mean, sometimes you see these like $60 million Series A's. And so, it's different. When I grew up, it was 500K, then 2 million, then maybe 10 million. And you'd be really far down the path before you raise $60 million.
And there's also a lot of geographic variance, right, around the definitions of these rounds, because East Coast tends to be a little bit more conservative. Our Series A's tend to be slightly later stage companies than, let's say, you would find a Series A on the West Coast. The rounds tend to be a little bit smaller maybe than what you would find on the West Coast. But for DreamIt, my fund, we're a late seed Series A investor. We want traction too, but our traction's different than yours. Okay. So what do we mean? I think a lot of founders are like, oh my God, if I don't have sales and revenue, I don't have traction. If I don't have paying customers, I don't have traction. But that's not the only definition of traction, right? If you have proof points, you have successful pilots underway, there's a signal that you've deployed the platform and customers used it and they loved it. They're putting it into their budgets. You're moving through contracting. You may not have a dollar in actual top line revenue yet, but for a late seed Series A investor, that's traction. That's market validation. That's sort of product market fit validation that someone uses it, loves it, is willing to pay for it. And hey, you've got a robust pipeline that looks like it's going to convert. That would be okay for us. That probably wouldn't fly for you, Gerhing, right? That's probably still a little bit on the early side for a fund like yours, but it's right in the strike zone for an East Coast late seed, Series A type investor. So we see the world. Now, I think universally, one of the challenges, whether it's that we see all the time, and I think it's maybe you see it less in the later stage companies, but for the academicians who come up with a great idea, we always say the single most important part of the story, and what if you want to raise capital for these brilliant ideas, you've got to build a great story around it, and that starts with defining the problem. And I know that's been covered a little bit during the session, but when founders show up to you, Tracy, how do you help them to sort of come up with that problem definition? And do you find what I find very frequently, we talk to founders all day, every day, they often start the conversation with, here's what my widget does. And that's not really the right place to start, right? The right place to start is with, here's the problem we solve. Do you find that as well? And sort of how do you encourage these early stage, these founders to figure out a compelling problem statement?
So absolutely, everybody comes to us with their widget that's going to change the world, and it's probably not. But we encourage everyone to go out there and start using the resources that the universities have. Talk to the MBA students, get some enthusiasm from the university itself to really understand what the market is that's going to be there for your widget, for your product. As you picture it now, we know that what you have in your hand is not going to be what goes on to the market. Everyone knows that. It's going to go through prototyping. It's going to go through development stages. But you have to use what's available to you, either in your university, at the Biotech Center here with our wonderful Life Science Intelligence group. Use the resources available to you to figure out what the problem is, absolutely, that you are trying to solve, and talk to people outside of your university. Because just because someone at Wake Med or at Duke thinks that they need this surgical instrument does not mean every hospital in the United States is looking for that surgical instrument. Really get out, and we encourage that. In fact, our translational research grant, a portion of the funds can be used to start those what we call business case activities. Hire the consultant or hire a regulatory expert to really just start to understand where your product fits in.
Yeah, several important points that you've raised there. Number one, if you're not solving a big and urgent problem that a lot of people, what we would call a market, want to solve, then the rest of it just doesn't matter. It doesn't matter how amazing, innovative your solution is. If there isn't a business case and a market opportunity and a problem that somebody with budget authority is willing to pay for to solve, you don't have a business. And I think that's, it's so important for founders to really understand that. I once had a conversation with a brilliant clinician from a very famous children's hospital in Philadelphia that shall go unnamed. But that clinician came and pitched my fund, and we said, well, why are you so passionate and what defines success for you? And the clinician said, if my device just saves one child's life, this was worth it. And to them, it was absolutely true. But as an investor, that doesn't mean you have a commercially viable business model and a venture backable business that'll generate the returns. At the end of the day, you have to remember, professional investors are being held. We have a fiduciary responsibility to the investors in our fund to generate a return back to them. So while there's certainly, I think a moral, spiritual, ethical, loyalty, commitment, belief that we're going to fund platforms that are going to make people better and make the world a better place, we won't be around for long if we invest in that product that only saves one kid's life and that the rest of the world's not really willing, to pay for. Rick, when the academicians show up to your office, is this an area that you need to help coach them, or is there pretty much a high level of awareness around market opportunities and figuring out how big the market potential is, those kinds of things? And then if they need help there, what do you encourage? What process do you encourage them to go through?
Yeah, most of the time when they come to us, they're pretty well thought out. Sometimes it's really early stage idea kind of levels, but rarely. Most of the time they're pretty far along. But again, we have a staff that really kind of work with them. Additionally, we have some mentors. Travis Manasco, the physician I mentioned earlier, is one of them. So we have mentors within the system that have been there, done that, and we try to match those individuals up with a mentor internally here at WakeMed. And again, I'm speaking towards the internal innovators that we have. So that seems to work really well for our group. The other thing that you mentioned earlier that I'll expand on a little bit is there a market? Is there a need? That's one of the things that we enjoy here is we can go to the exact spot in the road where this new idea is supposed to work. And we can ask the people on the front line, is this something that needs to be solved? And that's kind of what we do very, very, very early on in the process with those entrepreneurs. Then we take it to the next level and we have them come in and present to that group of potential end users or interested parties. And from that's how we make our decision as far as, who we innovate within the system itself. So we kind of are able to maybe cheat a little bit because of the assets that we enjoy at WakeMed. And then the last phase of it really for us is we have a partner, Hatteras Venture Capital, that largely is healthcare based only. And we have a chance to bounce things off them as well as far as, all the business components of a potential investment or a potential new idea. So we take advantage of the assets that we have, and I think we enjoy, more than most. And hopefully that makes us make better decisions and also attracts folks to, our WakeMed community to innovate.
Yeah, it's one of the important points there is that if you're a clinical innovator, you have a huge advantage in terms of the access to the resources that guys like me, I have to beg, borrow, and steal to get meetings with clinical thought leaders and to get that feedback. But if you're a clinician within an academic or any medical center, really, you can go talk to lots of your colleagues, on breaks, between cases, while you're on the floor, right, to get that feedback. And as an investor, we love nothing more when we hear a founder say, and I talked to 150 doctors, which literally one of our companies said. He was a doctor and he actually talked to 150 doctors to validate the need, and not only validate the need, but to inform the product specification. What does this platform need to do to solve this particular problem in the eyes of my potential customers? So yes, please chime in, Gary.
Maybe one other component for folks to consider. We've talked about the problem, the market. I think most people focus on the science and technology of the widget early on, but really an important component is time and adoption. And what I mean by that is usually folks are not wrong when they say it's going to be better for the patient or it's going to reduce costs in the healthcare system. I mean, if those are true statements, hopefully we will get there. I think the issue is how long it takes to get there, and that really sometimes dictates whether or not a company is successful or not. And a great example is laparoscopic surgery, which when it first came out, it seems like a no-brainer, right? I mean, you can take a procedure that's cuts the patient open in the stomach area and reduce that to some small holes, and instead of 5 days in the hospital, you're sort of 1 day in the hospital. It felt like a no-brainer until you realize that surgeons had to take 3 hours to do this procedure instead of 1 hour, and then they don't care how long you're in the hospital. So the technology, of course, now is widely adopted, but it took more than 10 years because the incentives were not lined up. So the end state of better patient outcomes, better health economics was true, but if you had invested in laparoscopic surgery early on, you would have been toast. So I do think that the time frame is really important to think about the adoption curve, in addition to overall is it a good market or not.
Yeah, a couple of points there to expound on a little bit. So one, why does time matter? I mean, hey, if I'm going to revolutionize the world with laparoscopic surgery, it takes 5 years, it takes 10 years, so what? I mean, it's amazing. It makes the world a better place, and it's going to create a new industry. So, I mean, why do you care if it's 5 years or it's 10 years? So what?
Well, I know you're asking this tongue in cheek, but obviously, during those 5 or 10 years, presumably the company is burning capital and somebody is funding that. And, investors, as you pointed out, have a fiduciary responsibility. And unfortunately, in the situation where I told you we partnered with a company that was in year 18 and had raised $200 million previously, those previous $200 million, did not do very well. And so, I think investors are cautious.
Exactly. Yeah, you're right. Obviously, I'm tongue-in-cheeking a little bit, but I think what a lot of entrepreneurs don't realize is that as investors, we're held accountable for the return, the rate of return on our fund, and time is the enemy of the rate of return. So you get the same exit at 10 years, it's a much different rate of return than you got at 5 years. And it's the difference between being an exceptionally performing fund and a not so exceptionally performing fund, even if the absolute amount of money returned is the same. So time is so important for everything we look at. I think the other point that you touched on that's really important, Gerhang, is workflow. And I would love to hear the panels, because I find a lot of times when we look at startups, particularly clinician-led startups, you would think they would be the most sort of in tune with workflows. But a lot of times we have founders who come and like, I've got the cure for cancer. And you only have to do another 30 minutes during the surgery to implement what I've got. And man, the outcomes will be great. So whoever wants to chime in here and we can sort of go around, when you look at a new platform, when you talk to a clinician, how much do you think about the integration into the existing provider workflows? Rick, you're nodding your head. You want to go first?
Yeah, we think about it a lot, because I don't know if we work on the Epic platform for electronic medical record, and in order to get adoption from our clinical team, if you've got to go outside of that EMR to do your work, Katie bar the door. It's not going to be a good sled ride for you. It is going to be, very bumpy, if not dead stop. So yeah, the workflow is incredibly important. That's why, I think, my advice, and I hear you, Adam, when you say how hard it is to get in front of colleagues, clinicians, those type of end users. You got to do that early on, because you got to have a problem they want to solve, and they have to want to solve it. So for them to come out and change their workflows, that's really tough stuff. So that's a great piece of advice that we can leave everyone with today.
Anybody else want to expound on that?
Yes, I agree. I think it's really important, and it's important because not only that, you're going to get the resistance from the end users, even if you actually got a contract or have gone through the process and got into a hospital system, and they actually did purchase a bulk. If the practitioners just kind of go, no way, Jose, I mean, this is not making it more efficient, and they don't adopt it, then it may be there for a little bit, but it may never get really integrated into the system. So, for example, like my product, we worked on making sure that one product can solve issues for all the airways. So it took twice as long for us to iterate and work with the practitioners. How can we make this better? Well, I mean, if I have to use different sizes for 4 different airways that we use, it's not feasible for us to have that in inventory. So all those little things you have to think about, making it not only the design is great, but to make it efficient and make sure that it truly saves time rather than prolonging how you use the product. I think that is really important.
Yeah, couldn't agree. Go ahead, Karen.
I was going to give you one example that you raised, which I think is great. There was oncology is an antibody used in oncology, and it had a certain amount of efficacy, well known. And then a new drug came that was essentially a radio-labeled antibody, so it delivered the same antibody but tagged with some radiation, and so it actually had better efficacy. We're talking about cancer here, right? You think that people will do whatever it takes to get a little bit better outcome. And it turned out the adoption for this new radio-labeled antibody with better efficacy never happened because it doesn't take just the oncologist. Now you need the radiation oncologist involved, and all of a sudden the workflow getting 2 physicians to agree and put it all together made it so logistically challenging that a better therapy was not adopted due to workflow.
I love that story, and I'll tell you why I love that story. Because before this, I always would say, if you had the cure for cancer, but it added 10 minutes to somebody's day, nobody would use it. And that story you just told proves it. Yeah. Now I actually have the evidence to back up my statement. All right, I think we need to leave it there. Thank Tracy, Corey, Garheng, Rick. This was awesome. Thank you so much for doing this. Great conversation. Want to extend sincere thanks to everybody in the audience for participating. I think we're going to be taking a short 10-minute break right now. We got a quick statement coming from Tracy. And then we're going to take a 10-minute break. And the break has been brought to you by Crosscom, a software development firm that develops healthcare applications. So thank you, Crosscom, for sponsoring the break. And Tracy, you've got a quick statement, I believe.
So thanks, Adam, and thanks to the whole community out there. And this is a really great opportunity. I think this is a special funding opportunity that we are supporting here at the Biotech Center. So my name is Tracy Delani, and I am with the Biotech Center in the Grants Group, and I am really excited to announce a special funding opportunity for clinician innovators here in North Carolina from NC Biotech. The Biotech Center offers many grant programs to researchers in North Carolina, and today we want to announce that our next cycle of our Flash Grant program, if you could please advance the slide, will be focused solely on clinician innovators. Only clinician innovators will be eligible to apply for this next cycle of our Flash Grant, which has a submission deadline of December 8th. Flash grants are micro grants of up to $20,000 that are designed to spark creative lines of research and advance potential life sciences discoveries towards commercialization. Flash grants fund development of ideas and potential products that may disrupt the current market and disrupt the way clinicians treat patients or innovate the ways healthcare can be delivered. There are 3 cycles of Flash Grant proposal deadlines every year, and each cycle has a topic and a topic-specific RFP. These topics are focused on emerging and disruptive areas of scientific research, as well as on topics of particular interest to the Biotech Center's mission. So for this cycle coming up, only clinician innovators, like the ones attending this conference, will be eligible to submit a proposal to the Flash Grant. All clinician innovators are encouraged to learn more about the Flash Grant program, and all eligible clinician innovators are encouraged to apply if they are designing or developing Class 2 or 3 medical devices, pharmaceuticals and biologics, precision health software, and clinical software and workflow solutions. All of the details regarding this cycle of the Flash Grant opportunity can be found on our website, and the guidelines for this next round can be found now at ncbiotech.org/flash. We're very excited to be funding clinician researchers who are developing new treatments and products needed by clinical staff and patients. Please feel free to reach out to me if you have any questions.
In the 1980s, North Carolina saw the coming shift from agriculture, furniture, and textiles to a knowledge-based economy. Our visionary leaders targeted life science. To create a thriving ecosystem for this emerging field, we bolstered our traditional strengths, recruited key researchers and companies, and built a foundation for sustained economic growth. Biomanufacturing jobs followed. University technology powered dozens, then hundreds of startup companies. Our full complement of support companies, unique partnerships, and skilled talent continue to attract companies today. In 1984, we established the North Carolina Biotechnology Center as the transformational catalyst to move the ecosystem forward. North Carolina has grown to 725 companies with almost 65,000 employees, producing more than $83 billion annually in economic activity. And we're number one in manufacturing vaccines and potentially curative gene therapies. Our state continues to transform, creating jobs, healing patients, realizing our vision to be a global life science leader. As Governor Jim Hunt and Governor Jim Martin so aptly expressed, no other state or country has established such a comprehensive and effective model to stimulate biotechnology development. Celebrating 35 years of life science transformations in North Carolina.
As caregivers on the front line, clinicians are well positioned to provide valuable input on the real-world application and feasibility of new healthcare technologies. And they're also well positioned to identify problems. A problem that a clinician sees every day on the job can turn into a novel solution or product to address that problem. These practitioners are going to share what inspired their innovative solution and what impact they hope it has.
Hi, my name is Andrew Prince. I'm a PGY4 otolaryngology head and neck surgery resident here at Carolina and co-founder and CEO of Lyra. At Lyra, we're developing an AI-based platform designed to provide video-to-speech technology, designed to empower and restore voice to voiceless individuals and help address the over $9 billion lost across the U.S. healthcare system each year. The inspiration at Lyra came out of a clinical encounter. I was taking care of a lady from Western North Carolina who was flown in earlier that morning. She had been for the previous month having increasing shortness of breath. We ultimately had to place an emergent tracheostomy in the ER for a throat cancer. And she was waking up later that afternoon, realizing she couldn't speak, hearing for the first time she had cancer, and living with the reality that her family still in Western North Carolina couldn't afford the gas money to come and visit her at UNC. Ultimately, over the course of an hour of trying to communicate with writing, drawing, and gesturing, a panic attack ensued. She kept trying to communicate with us, but of course not a sound would come out, and most starking was when she was screaming, red in the face, mouth wide open, and still silent. It was in that moment that I realized that if we can't lip read as humans, perhaps a computer could learn how to do it.
Good morning. I am Dr. Michael Schur. I'm a general surgeon with a specialty in wound care and burns and traumatic injuries. I am the chair of surgery at Mayhec and run the general surgery residency program at Mayhec. I'm also a founder and chief medical officer of Embed Biosciences. When I was professor of surgery at the University of Wisconsin, we had a 15-year-old autistic boy who really sustained a severe thermal burn from a candle that caught his clothes on fire. And we did surgery on him. And unfortunately, all of the work that we did got infected and failed miserably. And we had to reoperate on him to get his wounds to close. And he was a big inspiration for me to think out of the box and to say, what can we do differently? So we submitted some internal UW grants and some NIH grants and got $4.2 million in NIH funding and developed MicroLight. MicroLight is a brand new technology for the therapy of burns and wounds and surgical procedures. It is a multi-layer matrix that supports the growth of human cells, but also kills bacteria and yeast in wounds. This technology really will be fundamental in changing the care of patients with chronic wounds, burn wounds, and hopefully prevent surgical site infections.
My name is Patrick Codd. I'm a neurosurgeon at Duke University. I'm also the director and PI of the Brain Tool Laboratory, which is a translational engineering laboratory within Duke. I'm also the founding member and chief medical officer of a startup company called Mente. When we came up with this technology, it was really born out of just looking at my own clinical practice in my own environment. I just saw the problem that I was experiencing where I was missing instruments that I needed, that things weren't in place, that the clinical team was overwhelmed by the number of tools that were being brought out. And it was basically by saying, hey, that's a problem for my own practice. Like, what can we come up with solutions? And just starting there with the need was where we started. Didn't, ignoring the fact that it later took all the development and all the prototyping and moving this through the university, doing studies and eventually moving them out into the world as a startup company. All of that was secondary to the fact that it starts with the need first. And that need is right in the middle of your own clinical practice. It wasn't mine. I could recognize that I got too many instruments here and it would be great if I didn't have as many. And how can I make that better? And that's just where I started and then built a team around that. So it really starts with the need and the idea first and then slowly build from there. It takes one step at a time.
Hi, my name is Edwin Cadet. I am the CEO and founder of SP Innovations. I'm an orthopedic surgeon specializing in sports and shoulder surgery here at the Raleigh Orthopedic Clinic. The innovation that we're doing is trying to create a specific graft to address rotator cuff issues, specifically massive rotator cuff tears. It's a lot of hard work. It takes a lot of time, But if you're passionate about something and you can see the potential benefit to mankind or to patients, there's nothing I think more satisfying than to see an idea that you may have or may have originated with someone else come to fruition and get into the hands of other clinicians where they can help patients and patient outcomes.
So MicroLite has been shown to really impact the healing of chronic wounds. And chronic wounds are a major burden in healthcare in this country. Patients really struggle. They're in pain. They have dressings. They have multiple doctor visits. And chronic wounds take a very, very long time to heal. We have shown in a prospective clinical trial that was recently published that the use of MicroLite Matrix speeds the healing of chronic wounds. So we know that it works in chronic wounds. What we really hope to show as we collect more data in the future, that it could prevent surgical site infections. And a surgical site infection, according to the government, is a never event. It should never happen. But the reality is, if I take out the colon, I get a surgical site infection about 12% of the time. There is no other potential therapeutic that is on the market that you can put in as a bioresorbable. So I can take out the colon, I can close the abdominal wall, put a piece of MicroLite in the wound and close the skin over the top of that and know that there's antimicrobial activity for at least 72 hours in that wound before the matrix dissolves away.
Our hope at Lyra is that this technology revolutionizes communication for aphonic individuals. As much as the wheelchair changed the paradigm of an individual requiring crutches to get around, we hope that our technology will be able to restore voice and communication in a way that's currently unimaginable. I hope that voicelessness just becomes another blimp and really something that people don't even think twice about when they go through these procedures.
Okay, so good afternoon. Am I live and available? Can somebody make sure my mic is on? Yeah, okay, good. So I'm Jeff Lawson. I'm Duke vascular surgeon, as well as the founder of a couple of companies, chief surgical officer at a company called Humacyte, which actually just went public. As well as the founder of another company called Innovask, which is a vascular device company, and on the board of directors for that company as it goes forward. So I've been involved in vascular surgery innovation, but I think what's really inspirational is hearing the previous presentations is these other people that are interested in innovating and developing new technologies. And that's part of what this panel is about. So first I want to thank Greta, who at NC Bio had, really drove this thing forward. And Greta, a huge amount of congratulations for putting this all together. And then I also want to recognize LifeFlow Plus, which is one of the companies that's involved in, I think, recirculative technology. And LifeFlow Plus is a sponsor of this session. So I want to make sure that they get recognized for sponsoring the session that we're doing. And I think today's session is really driven around the innovators, the people that we're going to be speaking and being part of this panel, of like what drove you or what got you to where you were as a healthcare provider to want to innovate and then want to form a company. And then how did you form a company? And then what were the barriers to making that company successful? So maybe I'll ask each one of the people, we'll introduce them sequentially, not by any order, but I think there's four of us as 4 or 5 of us as panel members. But Leon, are you on the call still?
Yes, I'm on the call. I'm here.
Yeah, maybe you just want to introduce yourself briefly and sort of give a maybe 1-minute summary or 2-minute summary of what you do and how you got here.
Right. My name is Leon Desjardins. I'm a pediatric ICU physician by training, and I formed a company called Ideal Medical Technologies. And I've been working since, believe it or not, 2007 on creating a artificial pancreas for use in the hospital setting. It's an AI-based platform. And essentially, I've been taking care of diabetics for almost 35 years in the ICU space, and I know how difficult it is to control their blood sugar levels. And then when the literature started coming out with about glucose control being important in 2001, I got interested in how that might be done safely and effectively. And I realized that I could take my base knowledge of taking care of diabetics to create algorithms, to create AI-based software. And that's what I did. So I've been on a long journey for the last 15 years, bringing this software to the forefront. And, as of now, we've gotten breakthrough medical device status from the FDA, and we're about to launch into our first clinical trial. So it's been a long journey, but basically I saw a need in the space, and I realized how it could be done, how the need could be solved. And so I just kind of went for it.
So that's wonderful to hear. Dr. Hussain, do you want to briefly introduce yourself? I think you're on mute, sir.
Sorry about that. Yeah, you guys got it. Hey, I'm Iltafat Hussain. Sorry, my video is a little bit off. I had to kind of be mobile today, but I'm an assistant professor at Wake Forest University School of Medicine. And background is in starting a couple different health informatics companies. The one that's most notable is Empathic, and it's really, the idea was born around, I'm an ER doc, and it was born around, hey, how do we do less unnecessary stress testing, unnecessary cardiac workups on patients? And we were able to use the research in our department, and with the research in our department, we're able to show, hey, we've got a great protocol that can be utilized to reduce unnecessary testing. And then I helped kind of create an application for that, an iOS app, and then we turned into a smart fire application in Epic. And then we're able to get various types of grant funding that we'll talk about a little bit later, and now have the tool live in several health systems across the country as well. So it's been a really cool journey over the last 4 or 5 years that we've been doing this.
Well, thank you. And maybe Jekko, do you want to introduce yourself just briefly? If you have a second.
Again, thank you, Greta, and thank you for the opportunity to participate in this quite exciting event. Long story short, I did not know the term intellectual property. That's how I kind of got started. So currently I have close to 15 patents, and we were able to, I would say, a little bit on my part, blindfoldedly bring a product to market and license it to a company, and now it's kind of successfully implanted it in close to 4,000 patients. And this is a product that supports the sternal closure in high-risk patients, obese patients with COPD, patients with diabetes. Again, I saw the need for this because I had to operate on a patient that had undergone CPR, chest compressions, and the sternum was broken. I did the bypass operation, everything was successful, but then I had problems closing the patient. I kind of MacGyvered the closure, but then I thought that should be a better way. And then thinking a little bit more, I figured that that's probably single bone in the body that's fractured, obviously, but not splinted, which is like against the principles of orthopedic surgery, I guess, or any surgery. So it should be done electively, not only on patients. And then thinking about it, looking around me, I'm board certified vascular and cardiothoracic surgeon. So I saw that there are so many kind of opportunities to improve the technology, and that's how I kind of learned more about intellectual property, and I can kind of talk a little bit more in depth later.
And then I think the last person to introduce here is Karen, if you're willing. And Karen, you're probably the bravest of all. When I say that, because as a nurse, you've been innovative in a way where usually you think it leans into physicians or something. So I really want to recognize your courage and your development to take these things forward. Because anybody in medicine who understands or identifies a problem should be empowered to take it forward. And I really, really want to recognize you for doing that.
Thank you, Jeff. It's really my pleasure to be here. I am the founders and president of MyCare, and we created a portable nasal aspirator. It's pretty unique. But I am actually more passionate in my trade as a pediatric nurse. I've been spending over my 30 years of nursing experience taking care of children and baby that is admitted to the hospital with dehydrations and respiratory distress because of the RSV. Since it's a viral infections, other than we getting them hydrated, and then the only critical simple step we do is suction their nose. I literally spend almost a dozen times a shift to suction baby's nose, and so we know a lot about it. But a mentor told me that you may forget something that you hear and you saw, but you never forget somebody's emotions and feeling. So about 10 years ago, I tried to discharge a baby home. The mom got really upset with me, and she said, I don't want to go home because there is nothing at home that I can clean my baby's nose unless I can take the hospital suction and take you home with me. Otherwise, I really don't feel comfortable. And so she ended up staying 2 more days in the hospital before she felt comfortable to go home. So that kind of sparked me with that is a need. So over the next few years, I just kind of interviewed the parents, and I have found out that frustrations is really there, and it's getting worse and worse. So I decided, I'm going to do something with it. I don't have a lab like Dr. Kong say that all the instrument there. So I try to use what I have in the hospital and try to make do with something. And so I finally think that we really need a design more than just a simple make together. So with a lift of faith, I started the company and this journey in 2016.
Well, congratulations to you and to everyone on the panel. I think I have some questions. I want to open the discussion because this isn't a formal, like we're not going to give, each one of us is going to give a 10-minute lecture, but I thought I might open the discussion around what made any of you decide or have the passion to sort of say, God, this is a problem and I want to form a company to solve it. And maybe, Karen, I'll start with you. Maybe you first.
Oh, yeah. Well, I know one thing is I need to protect my IP from the very beginning. Because I remember I have an idea a long time ago, and then I saw somebody invented it. And so somebody told me, if you don't invent it, somebody will. So if you have an idea, protect it first. So the very first thing I did, when I decided to go forward with the journey, so I prayed for 4 things, and it happened 4 things just come into my lap. So I moved forward with it, and the one thing I would say, anybody want to do startup, you do need to get your idea protected. I met the patent lawyer in a dance party, and he was able to give me a good discount. So we started there, and I put the patent in my company, and I pretty much just kind of sitting and wait for the first real year when the patent is being, approved. Things more accelerate once the patent is granted.
So Leon, maybe just like thinking about that, like when you have a good idea, but then forming it in a business, how do you think about leadership? How do you think about getting the right business people around you? Because you're still going to have a full-time job, right?
Right. Yeah. I have still been working up until, we're about to start our clinical trials, and I'm still working as a full-time ICU doctor, which is probably not the optimal way to go about it, but I still have bills to pay, unfortunately. So my first inclination was to make sure the idea was even valid. So before I did anything, I agree with Karen. I first protected my IP. I'm up in Asheville, North Carolina. We didn't really have any patent attorneys up here at the time. And so I had to travel to Charlotte. I had to go to a bigger city to find a full-time patent attorney, or a firm, if you will, a patent firm. And so once I had that protected, I thought, well, I need to make sure it's really a valid idea, because it could just be that, I'm really, maybe I'm just crazy, but I basically used, I wrote algorithms that were biomimickers. So they mimic the native system. And I started testing them. So my first thing was to hook up to test it, and to get an engineer to help me test it. So I actually hired a local electrical engineer at UNCA Asheville to allow me to test it. And happens to be a diabetic, and he has a lot of experience with control, working on NASA programs and whatnot. And he felt very sure that he could beat my system pretty easily, since he had a lot of that experience. And my system badly beat him. He could never get close to it. So then I knew that I probably had a valid control method. And then I just basically said, well, what do I need to do to eventually get it to clinical trials? I knew in my field, that means I had to do simulation work on the software. So I did that. I had an electrical engineer help me do the simulation work, and we published a couple articles there. And I went into the animal space to prove it worked in a in vivo setting, and it worked great there. We put ourselves up against an experienced ICU doctor and outperformed him pretty easily. So that's when I really knew that I had something that was legitimate. So I did a very stepwise approach. I always tried to make sure that I didn't get too far if it wasn't going to work, but it kept working, fortunately or unfortunately. So I kept going deeper down the rabbit hole. And now I have a CEO who has 30 plus years experience in selling into the hospital space. And the biggest enlightenment for me was to realize that I probably shouldn't be the CEO, that really I should focus on the product, the device, and let somebody who's experienced in standing a company up, marketing and selling, do what they're good at, and I should do what I'm good at. So it took a long time for me to realize that, probably 10 years to really just, take a back seat to running the business.
Yeah, I would say it's a funny thing because, as healthcare providers, we're usually pretty smart, and I don't mean that to be arrogant at all, but doing business things are very different than taking care of people, or what got you, maybe what got you board certified. Anyway, I might ask the question, Dr. Sain, so around financing a company. Just thinking about, like, how do you finance a company? How do you get it off the ground? And you've got a good idea. Maybe you've got some IP protected, but how do you get the airspace for this thing now to be financed? And
sure,
the difference.
No, for sure. I think that's a great question. As a disclaimer, what I'm going to say is really just born out of my own experience, and there's so many different ways to approach this, right? The first thing I want to talk about is more private funding. And the reason I'm going to mention that private, I mean by yourself, is your time as a health provider is actually worth something. So oftentimes I'll see providers, when they go to investors and other people, and they say, oh, I just did this in my own time, and that's the amount of money that's got into it. I've always said, well, your time is worth something. So you really need to equate that idea and what went into it with the amount of time you put in. There's some really good non-dilutive funding that you can get from organizations in North Carolina. In particular, I want to give a shout out to NC IDEA. They're a private organization that supports entrepreneurship and innovation in NC. We were one of the 4 winners in 2016 out of the 150 companies that applied. And the coolest thing about that was the training and mentors that they provided really helped us really flesh out our idea. They had this like Shark Tank style approach of the pitches that you would do. It allowed us to meet a lot of private equity firms as well. So I'm really not exaggerating when I say that, Empathic really wouldn't exist if, NC IDEA hadn't helped support us initially. And that was something we just didn't know until we actually like looked into some of the support that's available in NC. And then obviously want to mention North Carolina Biotech Center as well. They offer, similar types of funding. And then there's grant funding as well that you can get. Some of the folks have mentioned that already. That's a great way to kind of prove your idea out, to do the research behind it, to do the clinical trials behind it. For us, it was like Donahue Foundation and other types of grant funding that allowed us to do some of these randomized controlled trials to really prove that our idea worked. And then kind of lastly, you can kind of run a company off grant funding itself, non-dilutive. But in my personal opinion, if you really want to be taken seriously and not be seen just as a lifestyle company, going out and getting private equity funding, I think is a big deal, because they'll really help you scale and become, I would say, a little bit more legitimate, and getting more than just that obvious capital infusion. You get a lot more from them as well. We got ours from Co-Founders Capital, local seed funding carry run by David Gardner, but there's several others that are out there as well. So there's several different types in North Carolina. I think initially I just didn't know what was available. I thought it was only grant funding, or I thought it was only private equity, but there's some great organizations in NC that you can reach out to for mentorship and help along that process for grant funding. And frankly, reaching out to other clinicians who've already done it and getting their advice is huge.
Yeah, I think you make a really, really good point, which is that, most of us, who've been in the conventional kind of medical model, is we think we have to write a grant to the NIH. That's the only place to go. Right. And but the truth is that there's a lot more, the DoD funds more medical research than the NIH does.
Right.
And family offices and other financial apparatuses, there's a huge amount of capital out there for innovation. And that's in NC Bio or other things.
Right. And the application isn't as long either. So
trust me. I spent years trying to get $1 million grant from the NIH. And I started doing this sort of in my world, where we were doing these raises for, and people are sliding like $10 million across the table.
Right.
Like, I don't understand that, but I guess it works.
Right. Right. No, you really hit it. Yeah, that's so key.
So Jaco, I just want to make sure you get a chance, because you're part of the Atrium Health System, and you've been creative and I think really excited as a cardiac surgeon. But maybe you can talk a little bit about intellectual property and how to get things going in a health system like Atrium.
Again, I was completely ignorant, so that actually helped me in a way. Again, I did not know. I kind of got a little. It sounded funny, the term intellectual property. So then I realized that there's like a.
It's like you're smart, like you're intellectual, but
but you don't own it really. It's kind of they question the ownership of your smarts. It's kind of a little interesting, but I kind of was very pleasantly surprised. The system supported me. Whatever I requested, they helped me with, but I don't think that Atrium is. And from the previous lectures, like for example, Wake Forest is probably better streamlined and better structured to help out a clinician with an idea. So it probably didn't help me much, but also it helped me because what I actually did, and I was very, as a surgeon, I guess that's why I'm kind of trying to be hands-on. So they explained to me there is such a thing as intellectual property, and then of course law involved. So I said I want to meet with these lawyers and I want to try to explain the idea to them, because in my head, the idea was very simple. It's basically sternotomy. You have to put two plates supporting both sternal halves, then put the sternal wires, which prevents the cutting through of the wires and stabilizes the closure. I thought it's simple, but it took some explanation. And interestingly, what happened with my other ideas and eventually patents, even that are experienced, you have to explain to them. I have to explain to the aortic surgeon why the idea is beneficial. And what's in my head, that's what my dad told me, what's in my head doesn't necessarily translate in this other person vision about the issue. And it's not only the language barrier, believe me, it's clinical understanding, 3D vision, clinical vision. Again, the hospital helped me a lot, and listening to all these stories from the previous talks and from this talk, if I had gone the other route to look for funding and testing and whatnot, this would have been probably successful, but it would have definitely delayed the problem, because within 2 years I was able to, number one, patent the method and the device for the closure, which is kind of, I guess, quite significant for something that's such simple. And then I realized that actually major companies are trying to kind of compete in the same field. So that was number one. I kind of found the company, and basically a company, the rep was kind of roaming the hallways. So that's how I found the company. We're able to convince them to kind of assist us with developing the product. I helped the company get FDA approval, because I had to talk. I asked the engineers and the lawyers of the company, what are our chances of getting FDA approval? And they go about 15%. So I said, I want to be on this talk with the FDA officer. So whether it was me or whatever, but we got the approval. So the product came to market from the initial idea to going through 510K. And on the market in less than 2 years, and it's performing very well. Then I kind of started thinking about this product in particular. I mean, I'm avoiding problems, but I'm also fixing the problems of all the other major companies that have invested so much money and whatnot. I guess my product is performing better. It can perform better on the market, but that's my that's up to the company that we kind of stumbled upon. And in the process, I started coming up with other ideas, and then I realized how difficult the whole thing is. Like having the funding, all these things are like I had no idea what I'm doing. But again, the hospital supported me throughout, helped me with all the patents, and now I'm to the point that I want to develop other ideas, but I realize how difficult it is. So,
well,
pretty much my story in a nutshell.
I was going to, and thank you. And we clearly have a great panel of people who've all been trying to develop things here in North Carolina. I don't know, do we have any questions? I can't see on the chat if so, Greta or someone, can you read them or list them? And if not, then I'm going to ask a few questions just out of fun.
I'd like to, kind of echo Dr. Sain say about the funding. Is a lot out there, but it's not easy to get. Actually, I am in debt with NC Idea, got a little micro grant from them, and of course, WakeMed has been a big supporter. When I started Journey, they don't have the innovation department, but once they started, they financially, supporting everything I do. I really, appreciate them. But I remember in the beginning when I tried to write grant, of course, I'm not very good in writing, and writing grant is new to me. Another thing is being a startup, you have to like learning a foreign language. I don't know all the terms and all the stuff in business. I only know what my trade in the medical field. So, but anyway, I had a really good friend, and he's also a founder, and he always told me is that you have to write about 10 grants before you will even get one. So don't give up if you write grant and didn't get it. It will come eventually. I recently get into like semifinal and finalists of some of the grant now that I have done a few times. That got used to it.
So Karen, I think you make a really good point, though, is that many of us who see these unmet clinical needs, and then they drive an inspiration to make something better. But we have trained, regardless of what your area is, we've trained for years to take care of people. We haven't been trained to raise money.
Yeah, it's hard.
But what I think I've learned is that if you have a really good idea, you got to be able to get money behind it. I mean, you got to justify it. It's got to be a good idea. It's got to be something that's going to help people. And if you can articulate that, then you should be able to get funding. And then it's what's the funding strategy? Is it the NIH? Is it NC Bio? Is it VC money? Is it family office money? There are, different ways to raise capital to fund your idea. But if you have a good idea, and that's something we haven't been trained to do, and is to kind of, and in fact, sometimes we're embarrassed asking for money, for, I think that's one of the things that is guilty as healthcare providers, is that's not what we do. We usually I'll take another night of call. It's no, I got it, no problem. We don't ask for money the way that other people do if you're more primarily focused in the business sector.
Yes, that question. But anyway, the eco resource that I use is by, I'm willing to learn, and somebody told me that I'm coachable, so I'm trying to get into any kind of workshop that I can to learn my basic knowledge, let's say. And when you go through those, they will have a lot of resource, and it's mostly from those programs. I was at the Propeller program at the First Flight Venture Capital now, and they have a lot of people providing you resource on where the grant is. When you start it, there are many things coming into your email.
So I think once you commit from transitioning from an academic enterprise where you're going to be dealing with NIH or something like that, NSF, to a company, I might ask, so maybe I can poll the team here, but building the right team around you so that you can be credible for funding. So maybe Dr. Hussain, maybe I'll ask you first, but so do you need a CEO, and do you need a CFO, or what do you need to get funding so that people, if they're going to slide $1 million across the table,
right,
they know you're a real guy.
Right. They always say we're not investing in your idea, we're kind of investing in the people, right? That's kind of the phrase you hear a lot. I think it certainly helps to have prior experience. That was one of the things that helped me as a med student. I'd kind of started there and was able to show that, hey, I can create a company and have it prove to be successful. But you definitely need we had a CTO, we had a COO. I was the CEO initially for a couple of years because I do think it's important for the founders to really flesh out that idea really well. I personally think that's a really big thing, because it's not as much really about the idea as it is what problem are you solving with that idea, and how are you going to solve that problem. I think you can have a great idea, and there's so many great ideas, and I've seen so many companies where I'm like, oh my gosh, I think that could save lives, or that does save lives. but it's just never going to really be implemented because you have to solve like a specific problem or a workflow for people, and really get into the granular details. And that's where I think the founders are most instrumental in terms of determining that, like, what is that when it comes to testing and working with beta users, about that. So I think, when you're asking for support, I agree, you have to have like a team, especially, when you're presenting to, private capital folks. You can't just, I think as an individual, just go out and say, oh, this is the funding I want. This is how I'm going to allocate the funding that I get. You really do have to have a team of individuals that will go into this, and really a full-time team as well. That's kind of important. You need a lot of team members to be, full-time there before private equity will basically say, oh, we're going to give you, $500,000, $1 million.
Yeah, and so Leon, I might ask you to say sort of the same thing. Like, I've had that experience. Like, who are the adults in the room? Like, and you're like docs, you're like smart guys or gals or nurses or whatever. But who's going to actually run the company and know how to like file something to the bank?
Right.
How do you build that?
Yeah, so I would say that for us, it started out with just a technical team. So I was a clinician, but I really didn't have the technical chops to take the algorithms and make them into working software or to link them up with glucose sensors and IV pumps. So I built out, we had a technical CTO come on board to do all that work. And I really delayed, and I kind of served as a CEO really just until this year, because we really we're not far enough along to bring in an experienced CEO, I didn't feel. And I felt that the timing would be around when we were approaching clinical trials. So basically I just used adjunctive help. If I was doing a regulatory filing, I would basically hire independent regulatory consultants to assist with those filings, IDE filing with the FDA. I did the breakthrough device filing myself, but then this year when we got FDA approval to start our clinical trials, I realized that, although we have, we applied to NC Biotech to their loan program and we're successful and they are going to give us a $250,000 loan, I realized that, well, in order to get larger streams of money to actually fund the company, build out the final device, pre-production version of the device, we need millions of dollars. And I really needed a CEO. So that's when I went out and found a CEO who has literally decades of experience bringing devices to market. So it's a timing thing for me. It was getting a CEO at the right time. Like 3 or 4 years ago would not have been the right time. They wouldn't have lasted. They would have quit. But now's the right time. And to be honest with you, we would have no chance of getting, $4 or $5 million checks without a CEO in the room. It was just myself and the technical person or two. We wouldn't get any money. So I think you need a business person to get the larger checks, and the timing's important. Don't bring them on until you're closer to coming to market, I would say.
Yeah, Leon, I completely agree that at some point you have to have the credibility for investors to be able to bring in the kind of money, and the kind of money you begin to talk about it's not trivial to make most of these things work. It's a real amount of money, and the real investors want to know who are going to be the real people that are going to be the stewards of the money, and they usually don't look to the medical professionals.
Yeah, they don't trust us.
That's not what we do.
Reason.
Unless you're quitting.
Even then, they don't trust you.
So, Jaco, I just am curious. I want to bring you into the conversation, Jaco, just as a team. What do you think about kind of building a company, or how you do that from your vantage point?
Well, as I said, we had a product that was successful. I was completely not related to skills. So now I have intellectual property that I can own myself, and some of it is with the hospital. And I'm kind of trying to figure out how to maneuver exactly the issues that you're kind of discussing. And again, you can be credible and have CMO and CEO and stuff, but you have to have, number one, patent, which costs money. And in the case of medical device, you have to develop a prototype. So this all costs money before you start doing FDA and market fit and whatnot. So this is the gap that is kind of the most difficult to kind of overcome, I guess. And again, it takes a lot of, and most of the time the investors are not skilled clinicians. And as I said, I'm a vascular and cardiothoracic surgeon. It takes effort on my part to explain to my colleagues why something will help them because their professor taught the Duke way. And he's doing well, the procedure is doing, the patients are doing fine. Why should they do something else? So it takes an effort to explain medical devices to investors, I think, or maybe, I mean, I haven't talked to many investors, obviously, but I think that problem that I'll be very specific, a surgeon clinician wanting to develop, I'm not talking about apps, I'm not talking about glucose checks, I'm not talking about maintenance of the patient in the unit, I'm talking about a medical device that will either be used in the OR or will be implantation. And what I realized, because earlier in the talks they said as clinicians that are busy, you have access to like the CEO of Medtronic, for example, or any company. You can talk to them, they'll listen to you, but then I figured that the big companies are manufacturers. They very rarely do anything innovative, very rarely. And they would rather give you $1 million to buy a company that's with FDA approved product than a couple $100,000 to develop something or to test your idea. At least that's my experience, which is by no means like extensive. So I have a lot of ideas. This is very beneficial. This meeting is very beneficial for me because it shows me that looking around me, my big institution, which is a huge clinical institution, there are no pathways to kind of facilitate any of these things. Like you have, the physician has an idea, they tell him it has to be patented, then it has to be realized somehow, either licensed to a company or you start a company. These are pathways that I expect to much better with our Wake Forest, because from one of the previous talks I kind of understand that there are pathways there, and obviously North Carolina is an awesome state. I've been here probably 22 years, my whole I never knew that there's such a thing. And again, I'm not a good example because I didn't know what intellectual property means, and I kind of felt offended.
We're going to have to start to wrap this up, but actually I really want each one of you, because it's so inspirational. I think that the thesis here was, you know, people who've seen clinical problems, they've identified clinical problems, and they wanted to innovate. So maybe if you could just summarize in one sentence, going kind of quote unquote around the room, just what would be your advice for other people who have that same passion but don't know how to get there? So, and maybe Leon, we'll start with you. So Leon, I mean, what would be your advice to somebody, maybe a junior faculty person that wants to find out how to get started? How would you do it?
I would just say that make sure that there's really a market for, you may have a great idea, but make sure there's a market for it, that people really want it, and then make sure that whatever your solution is going to work. Try to fail really early, and then if it doesn't fail and it's going to solve the problem, which you perceive to be a big problem, and you can actually sell it to somebody and they'll actually buy it, don't quit. I mean, the people who are successful aren't the smartest, and they're not the most innovative. They're the ones who just refuse to quit. That's the bottom line.
It's an endurance sport.
It is. Yeah, it's a marathon.
It's an so Karen, maybe you want to comment briefly?
Oh yeah, echo it very well. It's that many times in the beginning that I want to quit because it's so hard. I keep saying it's only get harder. I tell you, but what I would say, you can't do it on your own. So when I first came in, I had recruited 2 really good friends to help us to start the company, and just get a lot of advisor, do your networking. And a lot of time you're in the dead end. You have to think out of the box. I do try to get myself out of a lot of dead end before. It's just persuading, and also a lot of people, if you really talk to people, a lot of people like to help you without any repaying, and just find somebody who really share your visions and share your dream, and you will succeed. I think we're not there yet, but I get to a prototype. I'm wasting money for a soft launch. So I think I walk quite a bit, but still some more stairs to go. Just don't quit.
Dr. Hussain, do you want to give me your
I think my fellow panelists have really hit, on so many great points already. Just to add to it, I would say, you might have an idea that you think is like a no-brainer, and this saves lives. So obviously a hospital will want to do it, but it's not really what it's about, unfortunately. It's really about, are you really solving something that needs to be solved, making the workflow easier? Patience is another thing. Trying to break into a hospital system takes years. I know initially it was like, oh, we want our first hospital. Now we need another hospital system. And it's like, wow, okay, we finally broke into a large hospital system, but it took 2.5 years to do it. So you need to have patience, and then, you need to know what you don't know. So when you need to bring in like other folks that are just frankly more capable than you are, and that was already alluded to before, but I cannot emphasize that enough. You need to know what you don't know. And lastly, you need some luck. You really need some luck too. I've seen so many folks have fantastic ideas, fantastic funding, and their product not work. And you have to, you need some luck for it to work too. So.
Well, you definitely need luck, but I think, and as most of us and all of us, you need passion actually, and you need to be hands. I mean, everybody says the CEO, the CTO and whatnot, but in the initial stages, you have to be passionate, and you have to be passionate all along, but you have to be hands-on to be able to explain your idea. And again, as Dion said, let your idea fail early, or improve it and make it better so it doesn't fail. But little things like, for example, the way I changed the material for these plates, because they were titanium plates with stainless steel wires, and the German engineers were kind of worried about it. So I went and visited their factory and stumbled upon a log. I said, "What is this?" And they go, "This is PEEK." And I said, "What is PEEK?" He goes, "Oh, we do these skull kind of pieces when the neurosurgeons do surgery." So, okay, I forgot about it. So when we're looking for different materials, I said, "Can we use PEEK?" And they go, "Why not?" So that it turned out that PEEK has been used in spine surgery for decades. So it was a very easy transition, and that was the perfect material for the sternum. But again, you have to be curious, you have to be passionate, you have to kind of see what you're working with, and not quit. I guess we kind of know this. You should quit.
So Jaco, I was going to just say, and to add to some of the other comments, I had an old coach who told me that luck is when preparation meets opportunity. Maybe that's too,
without a doubt.
But it's about preparation. It means you've been training your whole life to do this. And the opportunity is like you have a damn good idea. And maybe some people say it's luck, but I think it's when you've been working your whole life to do this. And so I don't think it's an accident, but you have to capitalize on it. I think the only other real challenge, which I want to touch on because we have just a few minutes left, but which is the competition, because I have so many of my colleagues who have good ideas, and then they never follow through because they're busy and they've got a chart and there's RVUs and they have so many other clinical distractions. And it's, how can you kind of get beyond that to get that breath of air to get your idea that the airspace it deserves? And maybe just quickly for each of you that have made progress is how do you think you do that? Because that, I think, is one of the big barriers. And so Leon, so maybe how do you tell one of your partners, like, hey, you've got a great idea, you know, how do you get the
time? Yeah, it's very hard. I mean, honestly, for me, it was sleep deprivation. I mean, I did a lot of my work early in the morning. I raised 3 kids through all this and have a wife and other responsibilities. So you have to be so committed that you have to be willing to spend time, I wouldn't say away from your family, but maybe carve out a couple of hours every morning or late at night or on the weekends here and there. You can't do it full time to start with, but you have to have enough. You know, you're probably not going to be able to go to all these social functions all the time, and you just have to have passion, as it was brought up before. You have to have passion enough that you're going to carve out time out of your busy life to do it. I mean, there's no other way, honestly.
Yeah, any other comments from the panel?
Yeah, it's interesting. I give a lecture on burnout to my just residents and whatnot, and one of the interesting things that you find is what helps prevent burnout is doing things outside of just straight clinical medicine too. And I tell folks that this might be a passion that gets you even more excited about medicine, and you should really consider doing that, because I think too often we just we have these ideas, and then at the same time physicians were really good at complaining. So I always told myself, if I'm going to complain about the EHR or something, well, I'm going to do something about it. Like I'm going to create the tool. Like, why am I going to let somebody else create the tool? I need to be the one to do that. So we need to really take ownership of that from a physician and, provider and nursing standpoint. These tools that we're using, we should be at the table. We shouldn't let folks who, haven't experienced the daily things that we experience, dictate all of that without us being there. And I think that's what I tell folks. It's, hey, if you're going to complain about something, you're going to have an idea. Come on, do something about it,
Karen or Jaco, any other comments?
Yeah, my biggest things I would suggest is just believe in yourself, be committed. One of the things that really helped me through the year that I don't quit is all the advisor, the team that give you encouragement. So you don't want to fail them because they believe in you. And I think that's the most powerful backing me keep going.
I think as physicians and as surgeons, we're kind of engineer. I mean, I almost became engineer in my life. Education-wise and profession-wise, but I think it's good to be curious. We have to be curious as physicians. You have to be curious. So if you kind of capitalize on this a little bit and have a little passion, follow your kind of idea, try to develop it, help other people, inspire other people, because it's not only preventing burnout, but it's fun. When you do something with passion, it's definitely fun. When you do it by obligation, it's not that much fun, and it takes longer usually. The time continuum kind of compresses when you're doing stuff with passion. You always have time, actually, for your family and all that kind of stuff, and for kind of thinking about your idea. And on the other hand, sometimes you have nothing to do. That's what you do, think about your idea. That's how you fill up your empty space and time during the day and life, I guess, and career.
Well, I think we're going to have to wrap this session up, if I have my timing right, according to Greta and the team organizing this. But to the panel, first of all, thank you all so much for contributing and participating in this discussion. It's been great.
Thank you.
I would agree that, you have to follow your passion. And probably doing something cool and innovative is a lot more fun than logging into Epic. I'm just guessing, but I'm saying.
Without a doubt.
I think it kind of neutralizes the epic effect.
If you're complaining about something, you probably can do something about it.
Yeah, and so again, to the sponsors of the session, let's see, that is the LifeFlow Plus that sponsored this session. And I think at the end of this, I'm supposed to turn it over to Mary Beth, who's the Senior Development of NC Bio, for closing remarks. If I've got it right, we're at 3:30. I think we're at the top of the hour. So somebody from the managing part of this, make sure I'm on track. But you guys have been great as a panel. And if we can all get together in Durham or Charlotte or Wake Forest or whatever, we all have to have a beer together, or Asheville.
Asheville, a lot of breweries. Come on up.
Well, Charlotte is no worse, actually.
All right. Thank you.
Thank you.
Thank you, guys. Thank you.
Thanks, guys. Thank you. Really appreciate
Bye-bye.
it.
Thank you. Appreciate it.
Hey, everybody. Thanks to Jeff and all of the other healthcare innovators on that last panel. Their stories are truly inspirational and demonstrate the significant impact healthcare innovations can have on patient care and health outcomes. I am Mary Beth Thomas, the Senior Vice President for Science and Business Development here at the North Carolina Biotechnology Center. First, some thank yous. These types of programs are a big lift for any organization, and it really takes great partners to make them a reality. I want to thank the planning team, the core planning team, especially my North Carolina Biotech colleagues, Greta Brunet and Corey Curtis, along with our great partners at the UNC Fast Tracks program. Thank you for spearheading the coordination of this effort. A second thank you to the entire planning team. Next slide. Which included representatives from each of our health systems partners. Early on in the planning of this event, these partners recognized the value of this program and really stepped up to help create the content that you all heard today. And finally, it also takes the critical support we get from sponsors. So a big thank you to all of our event sponsors. It would not have been the same event without all of your support. As was already announced following the funding session, NC Biotech is proud to be using our Flash Grant program to support the next great set of disruptive healthcare innovations. Please visit our grant funding webpage to learn more about this program, and do not hesitate to reach out to our team. That is what they are there for, to learn more about this program. I've been listening in for these last 2 days, and I've heard some common themes. Focus on unmet clinical needs and talk early and often with end users. Be resourceful as you develop a potential solution. Keep in mind how any solution will need to fit into the clinical workflow. Build a great team. I cannot stress this one enough. The process that you're about to consider going into will be slower and harder than you think. Be ready to adapt. But finally, be persistent. As Dr. Tada noted earlier, some of the best solutions are the right solution to the right problem at the right time. And that might come from you. After today's sessions on deciding whether to start a company or how to raise capital to support the development of your idea, you won't be surprised by my next statement. This process will feel overwhelming, and you may often feel like you are alone in moving your idea forward. But as you have learned throughout this event, your way past this is reaching out to people. Leverage the North Carolina ecosystem. It's an incredible ecosystem. The clinicians that spoke at this event, the SBTDC, the First Flight Venture Center, and my own organization, the NC Biotech Center. Networks and partners will help you move past the obstacles and keep you moving forward. This event involved practitioners from across the spectrum. We have nurses, medical doctors, physician assistants, nurse practitioners, physical and occupational therapists, and dentists. This is truly significant because it will bring an innovation mindset to all of these disciplines. And while these fields have all advanced, they are far from perfect. Continued evolution through innovative solutions will improve healthcare and lead to better health outcomes for patients. And this is an end goal on which we all agree. Additionally, this event hosted over 100 students across all of these disciplines, thanks to our partner NC IDEA for helping support their attendance. They represent the future in healthcare. These students spend their days accumulating and synthesizing the medical knowledge that they need to practice. But this event has now exposed them to a whole new mindset that will allow for problem identification and potential solution development. Hopefully, this event has armed them with different knowledge set and a new slate of tools that will empower them to not only have great ideas, but understand how to move them forward. Many thanks to all of you that have spent time with us these last 2 days. Stay safe and thank you.